morning, everyone. The hearing of the Senate Blue Ribbon Committee, together with the Committee on Health, is hereby called to order. This is the hearing on the resolution directing the Blue Ribbon Committee and the Senate Committee on Health and Demography reported suspicious claims of hospitals and clinics with the Philippine Health Insurance Corporation, or PhilHealth, amounting to allegedly 2 billion pesos and other fraudulent transactions. Before we begin, I'd like to acknowledge the presence of Senator Coco Pimentel. Good morning, Senator Pimentel. I'd also like to acknowledge the resource persons who are here today. The Assistant Secretary for Health Facilities and Services, Regulatory Bureau, Department of Health, Attorney Nicolas Lutero III, the Head Executive Staff of the Department of Health, and the President of the Philippine Eye Bank, Dr. Dominga B. Padilla. Good morning. Of course, the President and CEO of PhilHealth, Attorney Alex Padilla. Good morning. We also invited the Professional Regulatory Commission for obvious purposes. Dr. Doble, who is the chairman, is not here, but is there anyone representing the PRC?
I'm with PRC and I'm the chairman of the Professional Regulatory Board of Medicine.
Yes, sir.
Maybe.
Okay. Dr. Miguel Noche, chairman, Board of Medicine, which is under the PRC. Yes. The president of Philippine Medical Association, Dr. Maria Minerva Kalimag. Ma'am, good morning. The owner of the, you're listed down as the owner. If you want to rectify it, please feel free. Owner of the Pacific Eye Institute, Dr. David Harold Gosengfiao. Please, morning. Yes, and then the owner of the Quezon City Eye Center, Dr. Raymond Evangelista.
Good morning, Your Honor.
Good morning. Then the representatives of the Philippine Academy of Ophthalmology, Dr. Maria Margarita Luna.
Good morning, Your Honor.
Morning, ma'am. And Dr. Maria Victoria Rondaris.
Morning, Your Honor.
Good morning. Okay. Thank you all for coming. We'd like to assure, before we start, we'd like to assure everyone that everyone will be given a fair hearing. Everyone will be given an opportunity to air their side. And if there's anyone that in the course of the hearing wishes more time, please feel free to contact the committee so that we can give you the ample time. Patas po dito, and I assure you that. And if you feel that you need more time, then please feel free to do so, to inform the committee. I see Dr. So is there, of the Internal Audit of PhilHealth. Dr. So, maybe you should join also as a resource person. Thank you. We'd also like to the representative of the Food and Drug Administration, Dr. Melody Zamudio. And of course, our resource person also is Dr. Marife Yap. Good morning. Before we begin, can we have the Director General administer the oath?
For those who have invited us resource speakers, please stand and raise your right hand. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth in this proceeding? Kindly nod your head to say yes. Thank you. You may take your seat.
Thank you. I understand, Dr. Padilla, you have Attorney Padilla. Attorney Padilla, you have a presentation. Okay. Please proceed. Attorney Padilla, you have the floor.
Thank you, Your Honors. Good morning po, Senator Pimentel and all other resource persons. And okay. PhilHealth is a social health insurance. Unlike HMOs and other insurance firms, our premiums are regulated, our mandate universal. We do not select our members nor impose higher premiums for the sick or the elderly. Every Filipino should be a PhilHealth member by law. For those who work, you have to pay and contribute premium payments to the pool. Employers should share for their employees. The poor who are vulnerable to many illnesses pay the lowest premium rates, which is shouldered by government through the sin taxes. Most recently, every senior citizen of the country becomes an automatic member of PhilHealth as well. We believe we have one of the lowest premium rates at 2,400 pesos a year to cover the principal member and all of his legal dependents. Despite the low premiums, we are paying an average of 11,000 pesos per confinement, equivalent to a total of 78 billion pesos of health benefit payments in 2014 alone. It was only 55 billion in 2013. Thus, the PhilHealth funds are government funds from the contributions of its citizens, rich and poor alike. As an insurance, it is meant to have every Filipino share on the financial burden for healthcare of those that get sick at certain times. Through PhilHealth, the well helps the sick, the productive helps those who are not, and hopefully the latter equally becomes productive. Yet, in line with our thrust for universal healthcare, there are those who choose to abuse and defraud the system for financial gains. There are those who choose to exploit the vulnerable, the less educated, the poor in order to using up their PhilHealth benefits so the abusers can enrich themselves. There are those who give a semblance of service but fall short of the required ethical quality standards. And guess who suffers the complications of loss of visions, limbs, and even lives? The poor have rights too. This is their story which we shall hear today. My words can only say so much, so let's hear it straight from a PhilHealth member's experience.
Tuloy ang investigasyon ng PhilHealth sa 10 eye center na naghahakot umano ng mga miyembro nito para operahan kahit hindi naman kailangan. Sa ganitong paraan kasi kumikita sila sa PhilHealth at nakausap ng GMA News ang isa sa mga pasyente na nauwi pa sa pagkabulag ang operasyon. Saksi si Lea Alves.
Hirap ako eh. Nahihirapan ako. Gusto ko makatulog. May pamilya ko. Wala akong magawa.
Ganun na lang ang sama ng loob ni Romeo Fernando habang ikinukwento kung paano ang pagkapa-opera niya ng katarata noong taong 2012 na uwi lang sa pagkabulag ng kanan niyang mata. Dumidilim naman ngayon ang paningin ng kanyang kaliwa. Patuloy ang investigasyon sa medical clinic na nag-opera, kaya hiniling ng PhilHealth na wag muna itong pangalanan. Pero sa paunang pagsisiyasat, lumabas na di raw dapat inoperahan si Mang Romeo.
Meron siyang hypertension and diabetes, very severe hypertension and diabetes. He went, but he still underwent cataract surgery even without preoperative workup.
Kasunod ng pagkabulag ay nagpa-laser capsulotomy naman siya sa hiwalay na Pacific Eye Institute sa Makati.
Tingin-laser ako, walang improvement talaga. Wala nangyari. 4 na beses. Hanggang sa'yo, ito ngayon, pahina ng pahina na. Padilim na ng padilim.
Sa pagkisiyasat din ng PhilHealth, lumabas na isa si Mang Romeo sa mga walang informed consent sa operasyon. Ang masakit pa, hindi raw talaga ito kailangan ni Mang Romeo. Kasama ang Pacific Eye Institute sa 10 eye center na iniimbestigahan ng PhilHealth dahil sa umunoy paghahakot ng mga miyembro ng PhilHealth para magpa-opera ng katarata na karamihay senior citizens. Napansin niya ng PhilHealth dahil sa paglobo ng sinisingil sa kanila ng mga naturang eye center. Noong 2014, higit doble ang inilaki ng binayarang claims ng PhilHealth sa Pacific Eye Institute kumpara noong 2013. Under investigation din ng Quezon City Eye Center na lumobo rin ang sinisingil sa PhilHealth. Pinahinto na ng PhilHealth ang pagbabayad sa claims ng 2 eye center.
Ang na-discover namin is these 2 eye centers perform yung hakot system. There are seekers. And then these seekers will find it, would search for patients as far as Northern Luzon, as far as Baguio, para dalhin sa mga facilities na to.
Giit ng Pacific Eye Institute, may informed consent ang lahat ng pasyente nila at di sila nagasagawa ng operasyon na hindi kailangan. Pero inamin nito nagapadala raw sila ng mga tauhan sa mga komunidad para imbitahan sa kanilang klinik.
It's part of marketing. I do it below the line, grassroots level. Kasi iba yung market namin eh. Me, I think I want to serve the people who really need it.
Itinanggi rin ng QCI Center na sangkot sila sa anumang anomalya. Libo-libong mahihirap ang kanila raw nabigyan ng dekalidad na serbisyo at pinananatili raw nila ang kanilang integridad. Hindi pa naman pinangalanan ang 8 iba pang eye center na iniimbestigahan ng PhilHealth. Ako si Lay Alves, ang inyong saksi. Tuloy ang investigasyon.
What the patient had experienced can happen to any other person. It happened yesterday, it's happening today, and it will happen tomorrow. Unless we all put a stop to it. PhilHealth is not just a payer. It's not just about the money. We are working to be guardians of the people's health. We should give a voice to those who cannot speak up against the injustices some of our members experience. We should only pay for ethical, quality healthcare services, nothing less. Insurance fraud or abuse is not unique in the Philippines. Sadly, it is a global epidemic, an epidemic of greed. A recent publication shows that the U.S. itself, among the more advanced nations and among those with the highest healthcare spending globally, struggle to contain fraud and abuses within their own health system. Just last weekend, 10 PhilAms were among 246 indicted for health insurance fraud in the U.S., amounting to $728 million. Perpetrators are getting more and more intelligent, wily, and innovative. Control measures have to be equally dynamic. This would be the flow of my presentation today, Mr. Chairman. It shall generally be 3 parts. The first part would describe PhilHealth, the PhilHealth benefit package for cataract removal, and how this is situated in the scheme of things. The second part would dwell on the perceived violations and findings of PhilHealth has observed to have been committed by certain accredited eye centers to the detriment of our members. And lastly, I shall hope to share with the committee what we are doing to address the problems and our recommendations for possible legislative action. Our payments are increasing. 5 years ago, we only paid about 30 billion pesos in benefit payments. Today, we are paying close to 1.7 billion pesos a week worth of hospitalization and other benefits. Through our payments, we hope to unburden our people of the weight of costly health care. Among those we pay for are cases of pneumonia at 15,000 or 30,000, depending on the severity, dialysis, normal deliveries, cesarean sections, and of course, cataract removal surgeries. Other benefits include catastrophic benefits as well as any and all conditions and ailments. PhilHealth has no exception, no exclusions, no pre-existing conditions. We cover them all with a range of 1,750 pesos to as much as 600,000 pesos per operation. Cataract removal, the subject of today's hearing, ranks fourth in our total benefit payments. We have paid for in 2014 at 2 billion pesos. But it is not just about cataracts, but the other procedures abused and taken advantage of. We are continuously monitoring, auditing, and doing fact-finding activities to safeguard the PhilHealth Fund and protect the welfare of our members. These activities are not limited to eye centers. We have devised what is called a Stop Claims Payment Order, an authority espoused within the implementing rules and regulations of Republic Act 10606, where we suspend the release of payments to certain facilities when there are red flags and badges of fraud. Such payments would only be released once we are sure that there are no violations of policies and that ethical quality care has been provided our members. If violations are identified, then the proper processes would then ensue, which may include legal processes and review of accreditation status. As a matter of fact, the eye centers were not the first facilities where stop claims payment orders were issued. A hospital up north has been suspiciously noted to be confining whole families for pneumonia, has also been the subject of a similar order late last year. Also, a hospital in southern Luzon and a couple more in Mindanao are being studied for stop payment within the month. Moreover, we are also taking into consideration stakeholder complaints, whether these come from government agencies, partner providers, or patient members. These are the list of the top 10 ambulatory surgical clinics nationwide based on total reimbursements for 2013 and 2014. As can be seen, most of these facilities are eye centers. Usually more than 80% of the procedures being claimed for reimbursements in these facilities are the cataract surgeries performed. In 2013, the top 10 alone accounted for over 500 million pesos of benefit payments. In 2014, this figure has increased to around 700 million pesos. The next table shows the top 10 and the amounts in the National Capital Region. If you notice, the same centers reflected in the top 10 national data are here in the National Capital Region, and the total amounts are also quite similar. Now, Your Honors, what is a cataract? I think the best people to technically describe this are here with us today. But from what I was told, everyone will develop cataracts as they grow older. The question is, do all of those who have cataracts need to undergo surgery? Apparently, the answer is no. Here are some facts about the cataract removal procedure and the range of prices of lenses being used. This is what PhilHealth pays for a cataract removal per eye. So a person can actually have as much as 32,000 pesos worth of benefits from cataract removal of both eyes. And we pay for everything already in the package, including a generous amount of 40% of the package as professional fee, or 6,400 pesos. The cheapest FDA-approved lens that can be used can amount to just a few hundred pesos and is also included in the package. Admittedly, there are more expensive lenses that can amount to as much as 50,000 pesos as well. For those who choose these types, they will need to be out-of-pocket payments. The cataract package is one of our earliest case rate benefit package of PhilHealth. The beauty of case rate is that the benefit amount is transparent to both provider of care, like doctors, and to the patient, PhilHealth member. Rich or poor, you get 16,000 pesos worth as a benefit per eye, thus emphasizing equity. It is also easy to administer those, thus assuring that we can pay providers faster than the administratively burdensome fee-for-service payments. What we are trying to develop is to be able to influence positively the provider behavior through our case rate payments. For example, we want to pay better for good behavior like serving the poor in far-flung areas. Also with case rate, we do not pay direct to members, but expect the facilities to deduct the correct benefits from patients' total bill as a service to our patients. Thus, it is the facilities that file the claim with us to save the member from the trouble of doing this themselves. We pay directly to the facilities. Unlike other benefits that require 90 days or 3 months before a similar procedure can be once claimed for reimbursement, a cataract procedure done in one eye only requires 1 day before another procedure in the other eye can actually be reimbursed. Of course, there are quality and ethical standards that must be followed to assure that patients are not shortchanged and that everything falls within the norms of propriety. After all, healthcare is a regulated entity. The Medical Act, for example, a law that governs the practice of medicine, mentions that solicitation of patients is unethical. The Philippine Medical Association and the Philippine Academy of Ophthalmology both have strict standards of care and code of ethics. In these documents, we could see that the patient's welfare reigns supreme. Patients' rights must be adhered to. Doctors should only perform procedures that are medically indicated or necessary. And patients must be well informed of all the possible consequences that may arise from having procedures done to them. All possibilities must be discussed and explored with the patients, no matter the educational level. It must never be a one-sided affair. In order to be paid reimbursements, PhilHealth requires all facilities wanting to be accredited to sign an agreement called the Performance Commitment. The Performance Commitment is loaded with provisions that guarantee patients' rights to informed choice and to avail of the best quality care available. They stipulate the partnership PhilHealth has with providers and the responsibility of these providers to inform patients of their PhilHealth benefits as well. PhilHealth accreditation and access to reimbursement is a privilege and not a right. A facility must conform to the stipulations of the signed agreement, otherwise their privilege can be revoked. No facility can just do whatever they want and demand payment. Here are examples of performance commitment signed by certain eye centers, thus they have agreed to follow the stipulations therein. So what is happening? Video first, yeah.
Questionable ayon sa PhilHealth ang biglaang paglobo ng medical claims ng ilang eye clinic. Hinala ng PhilHealth nang hihikayat ng mga pasyente ang ilang eye clinic para magpagamot kontra katarata kahit ang iba hindi naman daw kailangang gamutin. GMA News investigates ano nga ba ang modus sa likod nito. Narito ang report ni Lay Alves.
Ang Pacific Eye Institute, isa sa 10 eye clinic na iniimbestigahan ngayon ng PhilHealth dahil sa mga questionabling paglobo ng medical claims o singil. Malaking bahagi raw ng mga ito mula sa pagpapaopera ng katarata, kung saan ang bawat isang claim ay maaaring umabot ng 16,000 pesos kada PhilHealth member. Hinala ng PhilHealth, gumagamit ito ng mga seekers o yung mga taong naghahanap ng mga miyembro ng PhilHealth na papayag sumailalim sa operasyon.
Yung seekers, kasi bawal rin ho sa mga manggagamot na talagang mag-advertise ka at mag-solicit ng mga pasyente. No? As a rule, hindi ho, ano rin yan sa ethical practices nila. So, dapat wala rin seekers, tas lalo na kung babayaran mo pa. Well, for both. For both yan, kaya ganito kalaki to is dahil pareho nag-e-employ yan ng mga seekers.
Sa impormasyong nakalat ng GMA News Special Assignments Team, isa raw ang barangay poblasyon sa Alaminos, Laguna sa umunay pick-up point ng mga pasyente ng Pacific Eye Institute. Ang aming asset, kabilang sa grupong ito na sinamahan ng umunay nagpakilalang recruiter noong 1 taon, pasakay ng bus papuntang Makati. Pangako raw ng recruiter, walang anumang babayaran ng mga pasyente sa pagpapasuri at pagpapaopera ng kanilang mga mata, basta miyembro sila ng PhilHealth.
Tinanong niya kagad may PhilHealth ka ba? Sinabi po namin, meron. So, hindi na siya, no reaction, sabi niya lang. Tumayo lang siya.
Kwento pa ng recruiter, may porsyento raw siya sa singil sa bawat pasyenteng mahihikayat sa Pacific Eye, bukod pa sa Christmas bonus. Pagdating sa Medical Plaza Building, kung nasaan ang klinika ng Pacific Eye Institute, bumungad ng isang mahabang pila ng mga pasyente.
Pagpasok pa lang namin sa room, ang daming ng pasyente. Ang alam ko, umabot na kami ng 100 na pasyente. So, lahat yun, napansin ko, yung iba may opera na, yung iba mag-start pa lang din.
Gate ng Pacific Eye, bahagi lang daw ng kanilang marketing strategy ang pagbabayad ng mga dating pasyente para humikayat ng iba pang pasyente at wala raw silang nakikitang mali sa ganitong gawain.
Hindi kami maghahakot ng patient. What we do is we inform patients at the grassroots level. The patients are so happy and we tell them, oh, you bring us more patients. Diba? So some of them, they keep bringing patients and bringing patients and bringing patients. So nakakaawa naman. So we tell them, oh, you work for me na lang. You help explain to the others, they're employed.
Makalipas ang halos 6 na oras, sumalang na ang aming asset sa doktor upang magpa-check up. Ang payo ni Doc, laser surgery.
Sinabi niya na magpapasalamin na ako. Sinabi niya doon na kung matagal tayong hindi magkikita, pwede ko nang i-laser yung mata mo. So after noon, nung sinabi ko lang na, o sige po, kung ano, magpapasalamin na lang ako.
Ipinasuri ng GMA News ang aming asset sa 2 independent ophthalmologists sa Metro Manila at parehong nagsabi na hindi nito kailangang magpa-laser sa mata.
Based on my examination, I can't see any specific reason for a particular laser treatment.
Sa ngayon, itinigil ng PhilHealth ang pagbabayad sa Pacific Eye Institute at siyang pangklinika na pinaghihinalaang naghahakot ng mga pasyente. Lay Alves, GMA News.
Part 2 of our presentation would enumerate the findings of the corporation, Your Honors. Common findings are the following breaches. All of them employ seekers and do member solicitation. There are findings that some patients were given care below accepted standards. Number 3, some patients in the different eye centers may have had their rights violated. Number 4, not all doctors performing surgeries in these facilities are properly credentialed, putting some of our members at risk of receiving below standard or unethical care. There are findings that are also specific to certain eye centers, and most of these are in the form of actual fraud, misrepresentation, misinformation, and other falsehoods that deceive members and PhilHealth to get money. As we have already established earlier, solicitation is unethical, based on the standards espoused in the law and the Code of Ethics for the medical profession. Our performance commitment is clear that solicitation is not allowed, and thus reimbursement claims of facilities and eye centers for solicited patients should be denied. Moreover, the necessary processes must ensue to hold those responsible accountable. Note that seekers, when doing solicitation, usually ask first if one is a PhilHealth member. They do not ask if you need any health care or are complaining of any ailments. The idea is that what is important for them is to be able to get the money at the end of the process and not really be able to help. Thing is, when a seeker establishes that one is a PhilHealth member, then all these possibilities start opening up. There can be legitimate concerns that need medical or surgical attention, but there can also be fabrication of such need, and oftentimes patients do not know any better. 26 seekers were named by patients themselves through domiciliary visits, and the eye centers reap the benefits of claiming reimbursements from such activities. Aside from the actual findings, there have been reports of misinformation being propagated by certain seekers that entice PhilHealth members to undergo procedures that they are not well aware of. It has become a modus. Lilinisin ang mata, pakikintabin ng mata, libre naman. All these are falsehoods that lure the unsuspecting PhilHealth members. And in this modus, recruiters are paid a commission. So the business of exploitation has arisen. Another more recently reported modus is when the seekers act as syndicates. Now they demand kickbacks coming from part of the reimbursement per eye. Apparently, this modus, when employed, would eat up on what otherwise would be money that should have gone to the care of the patient. The second finding reflects the standards of this modus, when employed, would eat up of the patient. Timely follow standard practice recommends to be done within 24 to 48 hours after surgery, must be complications, and address this early. The essential period can be the difference between or compounding the patient. Some of these patients were indeed asked or so for laser procedure, even when they have not been complaining of any problems after their cataract surgeries. As far as expert opinion goes, laser procedures after cataract surgery, called YAG laser capsulotomies, I hope I pronounced that correctly, should be done only when certain density cause opacity are experienced by years. But here, there are cases that upon follow-up, laser treatments are performed as little as 1 month from cataract surgery. And some of these patients are not even complaining of any blurring. They just believe it is what is best for them as the doctors recommended. Here you will notice the YAG laser capsulotomy by doctors. We blacked out the names of the doctors themselves, but take note that in Dr. 29, 30, and 31, the YAG laser was only performed in 8 incidents, 3 or 2, which is how unusual the YAG laser capsulotomy is actually done. No? But notice, take note of the first top 10. And most of these doctors are also members or doctors operating in the existing eye centers that we showed earlier as being the top 10 in the country. In fact, many of these patients were asked to come back weeks after just to undergo yet another procedure, which in all indications may not have been necessary. To stress a point, we have the case of patient LA who executed a signed and notarized affidavit on her experiences with a doctor in one of the 6 eye centers. Said doctor does volume surgeries, possibly from patients recruited by seekers. The doctor and patient agreed that the worst eye, the left one...
Sandali po.
Yes, yes.
At this point, I'd like to acknowledge the presence of Senator J.V. Ejercito.
Good morning, Senator.
Attorney Padilla, you said you used the word volume surgery.
Yes, Your Honor.
Volume?
As in number. Yeah.
So
Dami. Yung dami
you
ho.
mean en masse? En masse. Paramihan.
Paramihan ho. Yes, Your Honor.
Which is unusual?
Well, it is unusual, but only because they have been using yung hakot ho, yung mga seekers, that they are able to perform the volume surgery.
Sige, please continue.
In this case, the doctor and patient agreed that the worst eye was supposed to be operated on. But when the doctor's attention was called, the doctor simply shrugged it off and said, pareho lang yan, o operahan rin naman natin yung susunod na mata next week. The doctor proceeded to operate on the right eye. The next day after the operation, he lost entire vision on that eye. Well, 3 months later, the good eye that was operated on, that fateful January day, was removed because of fungal infection and complications of cataract surgery. Patient lost her vision on her relatively good eye and eventually lost the entire eye as it had to be removed. What is even more painful was that the patient was charged another 14,000 pesos for using a lens that was not even the agreed type of lens, both the doctor and patient mutually agreed upon. Another case involves 3 patients, all operated on for cataracts on the same day, in the same facility, by the same doctor. All developed fungal infection, eventually became blind and lost their eyes. Said patients were not followed up immediately. That would have prevented complications. all operated on for cataract to question, especially since the particular one does involve all developed fungal infections. We can only imagine the risks the patients of this facility are being subjected to. Finally, there's the story is put into question. We can only imagine the risks. Those fancy words simply mean that the doctor punctured a hole. There's the story of patient RA. Those fancy words simply mean that the doctor punctured. This is an unnecessary procedure. Patient's condition did not improve. All these examples had the doctors and their facilities file claims with PhilHealth, and their claims were paid despite such types of care. The third finding involves violations against patients' rights. A patient has the right to have an informed consent before any surgery or procedure is done. There were cases when there were no informed consent signed by patients. In that form, it should be clear what procedure is to be done and who will be doing it. Some patients do not even know their doctors or have seen their doctors for the first time on the day of the surgery. It is also the patient's right to know the type of lens that was placed inside the eye. For example, in Facility P, 20 out of 29 sample patients were not informed of the type of intraocular lens implanted on the affected eye. The facilities agreed to do credentialing and privileging of their doctors, but recent pronouncements by some of these eye centers say they do not have control of the doctors that bring patients in the said facility. This is a breach of our agreement and places our PhilHealth members at risk of being treated by an unscrupulous, unethical, and poorly credentialed doctor. It is the facility's responsibility to make sure that the doctor has the proper expertise to have the privilege of performing specialized procedures. This is possibly one reason why we have an alarming rise in complications of cataract surgeries requiring corneal transplant for the past 3 years. Note here that prior to 2013, the number one indication for corneal transplant were due to infections. After 2013, the number one indication for corneal transplant is now due to complications of cataract surgeries. It is noted that lack of pre-operative screening and follow-up may be contributory to having complications of cataract surgery. There are also due to infection. There are also patient workup and timely follow-up. There is also the findings of actual fraud in one facility for fabricating credentials. Given the right information about their benefits, going the procedure its benefits. It was also observed that patients, while waiting to have cataract surgeries done, were being offered to have walls for free. However, the facility would claim reimbursements from PhilHealth. This is fraud. A facility has been using the name of other accredited doctors, just graduated from residency training program, just recently before that. Despite this, from 2013 to 2015, he has already filed claims under his name totaling 36 million pesos. He ranks top 2 in terms of highest volume of cataract and related claims performed by ophthalmologists in 2014, 908 total claims. The latter's reimbursements were paid to the facilities. Dr. BK performed the surgery. A recruiter seeker has been identified that actually teaches non-PhilHealth members to misrepresent themselves and guides them to which names of actual active PhilHealth members they can use for purposes of filing the claim later on. So these last few slides are actual examples of fraud. We stopped and will stop release of payments to any such facilities concerned that they may not continue to bleed public funds of inappropriate care and abusive, unethical practices. We wish to make sure that these facilities toe the line and give our members quality, ethical, healthcare services. Note that we have not suspended the cataract removal benefits. Neither have we removed any accreditation. Facilities under stop payment orders should continue to honor the PhilHealth benefits of members. The concept of the stop payment is to ascertain that claims that will be paid should be clean claims, free of violations and breaches. There are other observations as well that were taken into consideration, such as many of the facilities in the top 10 and some below the said list are owned by the same people or groups of people. The modus thus may be the same. The patterns of abuse may also be the same. Contrary to what others have been saying, facilities are ultimately accountable for what happens in their institutions. The performance commitment is clear on their liability. One of our findings noted that 3 doctors under Facility Q have more than 2,000 cases of misrepresentation and breaches with PhilHealth. The practice of apathy by the eye center to the inappropriate actions of their doctors, then claim from PhilHealth the monetary rewards should stop. Claims are filed by facilities. Payments are made to facilities. Institutions cannot escape liability. The Supreme Court has already ruled that facilities are accountable for the actions of their doctors and their professionals. Enumerated here, therefore, are the particular provisions of the performance commitment breached and violated by the said eye centers to the detriment of PhilHealth members and leading to abuse of the PhilHealth fund. By the way, the Supreme Court ruling, Your Honors, is as recent as 2010 in the case of Professional Services, Inc. versus Natividad Enrique Angana. Finally, Your Honors, Part 3, DOH recommendations insofar as PhilHealth and other stakeholder action can be made. PhilHealth is updating the guidelines in the diagnosis and management of cataract. Among the new provisions are, one of the accompanying stickers in the IOL shall be placed in the claims form. This is already done through an AO. Through a circular
out
issue.
today.
Yeah. Minimum frequency and timing for post-operative follow-ups are also being specified. Patient education is being emphasized. Setting maximum number per patients per doctor per day to ensure quality care is also being given, which I think will also has already come out, putting a maximum of 10 patients per doctor per day and a maximum of 50 cataract operations per doctor per month. PhilHealth is also working closely with the professional groups for the latter to more effectively police their ranks, requiring certification that the professionals are members in good standing of their respective medical societies is one concrete option being reviewed. We are also creating guidelines that may be used to identify and prevent fraud and abuse. Our recommendations for legislative action, we need stronger deterrence, Your Honors, and criminal penalties against social health insurance fraud and abuse and inappropriate activities. Incentives for whistleblowers and those who would report on social health insurance fraud should be also considered. Antitrust rules to address monopolies and oligopolies should likewise be addressed. That is all, Your Honors. Thank you very much.
Thank you, Attorney Padilla. Just a few clarificatory questions. You mentioned YAG laser as a follow-up procedure. Why? Is that covered by PhilHealth?
Yes, that is also covered by PhilHealth, Your Honor.
So there's an opportunity to make money
Yes,
out of
Your
it.
Honor.
How about wart removal?
Well, that used to be covered also by PhilHealth, Your Honors, but in a recent circular we issued because of the abuses. No, we have removed it as one of our benefit packages.
So,
temporary delisting of the wart
temporary delisting of wart removal.
Yes, Your Honor.
And how many have you temporarily delisted? among the services that you included
Can I
before.
ask Dr. Mingita to...
Dr. Padilla, please.
Yes, good morning, Your Honors. Basically, in consultation with the specialists, meaning the dermatologists, they actually requested PhilHealth to temporarily delist certain procedures because of the abuse happening and the potential for abuse. For example, because the mission vision of PhilHealth is actually health security, no? It's not a spa. It's not there to run a spa. It's not there to do cosmetics, no? So they themselves, and we should be appreciated, the dermatologist said, let's temporarily delist these procedures until we have measures, parameters, safeguards. For example, how often can you claim for a wart? When is a wart truly medical and not just cosmetic? So today in the Philippine Star, we came up, there is a list of temporarily delisted procedures. Temporary because they will again be covered after the proper parameters and guidelines have been established, and that is being worked upon. So aside from the flat warts, I think there are other lesions that are very generalized, that are often just abused through cautery and laser procedures. The list is in the Philippine Star today as a circular.
But have all of these delisted procedures been delisted because of fraud and abuses? Or there are other reasons for a delisting?
Yes, Your Honor.
Fraud and abuses?
Yes, all of them. Because patterns, you see, patterns of increased utilization of what appears to be cosmetic procedures. And
no, but the cosmetic procedures made their way into your list.
Exactly, sir.
So,
yes.
you know,
but that's why may I say something? I am the head executive staff of the Secretary of Health in PhilHealth, okay? And one of the priorities of the DOH now, and we started only this April, was to review the list of cases being offered by PhilHealth. There are some warts, for example, which are really medical and not cosmetic. Sometimes they actually interfere with your lifestyle. They actually, some moles are actually interfering with the person's lifestyle or even function. So, but unfortunately, the present case rate did not actually identify, and there were no safeguards. And that's what the Department of Health wanted us to identify. And so we are now in consultation with various specialty organizations to help us put parameters. So eventually, they will come back, but with safeguards as to how it can not be abused. That's basically the reason certain procedures were delisted, Your Honors.
In one of the recommendations, you mentioned a whistleblower. In this particular case about cataract abuses, do you have a whistleblower?
Yes, Your Honor. I mentioned earlier also that we have an affidavit, at least from several patients, no, who have lost their sight or become blind, no, after the cataract surgery.
So we have complainants.
Yes, Your Honor.
A whistleblower in my mind would be someone within the PhilHealth organization. Meron ba tayong ganon? Implied in my question is there complicity with a PhilHealth personality in
well,
this?
I don't want to exclude that possibility, Your Honor, but as of now, there is none in our investigations.
Okay, thank you, Senator Pimentel. Before we proceed, the committee would highly appreciate any inputs on proposed ideas for legislation, amendments to laws, especially later on, especially Mr. Dr. Noche, representing the Philippine Medical Board and the Philippine Regulatory Commission. Like, for example, the Philippine Medical Act was done in 1959. And the last time it was amended was 1965. So, you know, laws have to keep in step with the changing times. So maybe it's right to look at it. Secondly, we'd like to announce that the procedure we'll follow is the findings, the allegations against the two Eye Center, Mr. Evangelista, Dr. Evangelista, Dr. Gosing Fiao. Mabigat po ang mga bintang. So we will go through it one by one, and then we will, of course, give all you ample time to answer. But before we do so, before we start, just one incident that I'd like to look into is a report by Dr. So. Dr. So, it was reported that you received a threat. Am I correct?
Your Honors, good morning po, no, and all. Basically, Your Honors, no, what we've just reported for transparency, no, was, of course, our engagements, no, with the different stakeholders. So, admittedly po, in different occasions, the two owners of the different eye centers, of course, try to engage us po, no, and we'll just say it as it is po, no, na for one, no, we were receiving like PowerPoint presentations, of course, vilifying us, no, one way or another, and the other po, we just received phone calls po, no, and in the latest phone call, for example, no, one of the owners actually mentioned that he was, of course, disturbed, no, because it was his wife that was actually invited to the Blue Ribbon Committee, no, and because of that, it has become personal po. So after that po, he just said that he was giving me a choice, no, if I will stand by the erroneous, well, what he claimed to be erroneous findings that we had, no, and then they enumerated the errors, no, according to them. And of course, we responded by saying, firstly, we have no. This is actually not a choice, no. We have seen our auditors actually went out, and these were validated facts, no, at least from our perspective, and thus we will stand by our findings po, no. And of course, we also mentioned that if the insinuation is that, you know, because of the personal, the mention of nagiging personal na nga daw po, no, we just stress the fact that when we did the process po, hindi naman po kami na may personal. Hindi namin pinersonal si Dr. Gosing Fiao, hindi namin po pinersonal si Dr. Evangelista, no. So basically, that's these are the things that transpired lang po, no. And then of course later on they were asking how did this go about, no, parang ganun po, what were the inputs, no. So we who were there were names that were mentioned, no, if they were giving inputs po, no. So we just said that everyone actually, of course, were involved to give the inputs po. But at the end of the day, it was management that decided the actions po for this. So these were the things that transpired po in the past few months, no, after this.
So in other words, it was not a threat, it was just a concern. Or was it a threat? Was there a specific threat to you?
Sir, we just say it as it is, no. It was the call made was for example, no, mentioned na pinepersonal. So we just responded by saying na hindi naman po namin ginagawa yon. And
Dr. Padilla, you would like to say something?
I think Dr. So is embarrassed, but I think the part which he felt may have been a threat was when the person said, if you stand by this, then I will have to include you in what I'm planning to do. That's all. It wasn't general, what are you going to do? We don't know. But that statement, I will have to include you in what I am planning to do.
Now let's call a spade a spade. Yeah. Who was that who called you, Dr. So?
The call came from Dr. Evangelista.
Dr. Evangelista, did you make the call?
Yes, I did.
Did you
Your
threaten
Honor.
them?
No, I did not, Your Honor.
What did you mean by that phrase? What's that again, Dr. Padilla?
This is according to Dr. So. I will include you in what I have. I will include you in what I'm going to do. Something like that.
Yes, I think Dr. So can answer very well what transpired during our conversation, Your Honor. I asked him because the audit reports did not match our numbers. Hindi po nagmamatch yung numbers na binigay nila, na pinasa nila sa ating mahal na Presidenteng Alex Padilla, at yung numbers na actual na tinanggap ng center. Kaya nung tinanong ko po siya, Kasi po si Dr. Robertso, brad ko po sa UP yan, sa UP-PGH. Kaya po, nag-uusap po kami, wala po akong hinihingi sa kanya at wala po akong, totoo po yun. I think Dr. Robertso can attest to that. Wala po, hindi po ako lumalapit sa kanya sa kahit na ano. Pero itong pagkakataon pong ito, dahil hindi po nagmamatch, medyo po malayo yung numero na inabot nila kay Attorney Alex Padilla. At malayo yung nakita namin sa sarili namin clinic. So, ang iniisip namin parang mali yata yung basihan ng pagsususpinde. Ang sinasabi ko sa kanya, Robert, chinek mo ba yung audit bago mo siya pinirmahan? Ang sagot po niya sa akin, Your Honor, hindi po. Sabi ko, pero pinirmahan mo, Robert. Pinagkakatiwalaan ko po yung mga tao sa ilalim ko. Pero, Robert, ang laki na nung gulo. Umabot na yung audit report mo sa kung saan-saan sa loob. Ngayon naabot tayo sa Senado. So ang tanong ko sa iyo, pinirmahan mo nga, oo, umabot na nga doon, hindi mo na nga siya maiaatras. Pero will you still stand by it? O at least i-check mo man lang ng pangalawang beses bago sana tayo umabot doon. Kasi po napakahirap po, napakabigat po ng mga paratang sa amin. At kung yung mga numero po ay hindi nagmamatch, unfair naman po yata sa amin yun.
Senator Pimentel?
Tingin ko, klaruhin na natin yun, yung mga numero. Ano po
Yes.
yung, sige po, ano po yung,
Ito po.
ano po yung numero ninyo, ano yung numero nila, at explain natin yung discrepancy. Opo.
Okay. Yun pong numero, tungkol lang po sa QCI Center, ako nga pala po si Dr. Raymond Evangelista. Ako po ang CEO ng Eye Center Conglomerate at ang business name po namin ay QCI Center.
Sandali po. Yes. Sorry to interrupt, no?
Yes po.
Para mas orderly ang proceedings natin, siguro let's go allegation per allegation
Yes,
para
of
hindi magulo, no? Ang first allegation, yung pagkukuha ng seekers.
Yes.
O anong tawag dyan? Brokers o mga taong humahakot dahil may komisyon.
Yes.
May komisyon, ano? In fact, this morning, nagulat ako, yung Philippine Academy of Ophthalmology, meron pong ad na babala, matakot sa hakot. So at least you are taking steps to make sure that the public will not be fooled into going into unnecessary medical procedures and will not fall into the praise of those who make hakot o tinatawag sa English na seekers. Dr. So, dito muna tayo, but then we will ask both of you to answer. No? Dr. So, paano po yung nangyayari sa Pacific Eye at saka Quezon City Eye tungkol sa seekers?
Your Honor, no, sa findings po natin, no, the process po we went to the patients themselves. We identified patients from our database. We interviewed them, no, at sila po ang nagsabi na may mga tao po na nagpupunta po sa kanila, no, na-identify rin po nila kung sino-sino po itong mga ito. Nandoon po sa ating mga audit report that we have submitted po, no. And basically, these people gathered them. Sometimes they even offered pa nga ho the vehicles, no, to bring them to the facilities. Mostly po, doon sa mga affidavits or interview forms signed by these patients themselves, they also say na, of course, important po na tinatanong lagi kung PhilHealth members po sila, no. So, yun po, maramihan po silang dadalhin, no, dito sa mga eye centers na to, or tapos doon po pagdating ooperahan po.
So in other words, pagka ang tanong parati, PhilHealth member ka. So implikasyon, pagka hindi ka PhilHealth member, hindi ka hakutin. Tama ba?
Ito nga po ang mukhang nagkakaroon, may isa rin po kaming finding not related to the two eye centers po, no, na ngayon, pag hindi ka PhilHealth member, no, binibigyan pa po nila ngayon ng ibang pangalan na active PhilHealth member po. So isa po yan sa finding natin sa iba pong eye center, no, at ang nangahakot po tatago na lang po sa pangalang Maria daw po.
That makes it worse. So gumagamit ng pangalan, identity ng active PhilHealth member para lang maoperahan at makakuha sa PhilHealth.
Opo. So may ganun na po ngayon. Hindi lang po ngayon PhilHealth members per se ang hinahanap.
May nabanggit kang meron pang sasakyan na dadalhin sila. So may libreng transport from pick-up point to the clinic, and I suppose pabalik din sa bahay nila. Totoo po yun?
Well, nasa audit finding rin naman po natin, na record po natin, no, na meron pong mga ganong instances rin po. Opo.
Ano pong eye center yung nabanggit na may transportation?
Well, from my memory, ang sigurado po ako yung isa dyan is Borough, no? Pero hindi po sila kasama dito. Nandiyan na rin po yung interim report na sinabi namin. I will check po dito sa dalawa kasi it escapes
Maybe you
me
should,
right now po.
you're the one in charge of internal audit. You should have your audit findings in front of you so you can answer. I thought you had it committed to memory.
Chairman, Mr. Chairman.
Yes, Senator Pimentel.
Now, since Dr. So mentioned Borough, I noticed Borough was listed twice. Iba yun? Magkaiba? Sa top 10 ninyo sa 2013. Two times. One at the bottom, Borough Medical Center. Ang isa sa taas, Borough something. Ibang pangalan. Related entities, different, o typographical error? Ano?
Hindi ho, baka branch ho yan. Pero
tignan nyo. So, isipin yung mother at saka yung branch, top 20 sila.
Yeah. Branch.
Your Honor, it's a branch. Branch ho.
Si branch yung nasa baba. Si main office niya yung nasa taas. So, ganun sila ka-active yung dalawa.
Opo.
Dr. So?
Opo. Sir, we confirmed it, no? For Quezon City I po, may mga vans po, no, na nagdadala po sa mga pasyente. Some of them are actually from LGUs po, no. And for Pacific Eye, no, basically po ang naghahakot, may pangalan po yung seeker, it's called Yoli, no. Tapos tinatransport po sila doon sa eye center.
Kanino doktor tinatransport doon sa Pacific Eye Center?
Sir, sa Makati branch po nila at yung isa sa Quezon City.
Kaninong pangalan?
Sir, sorry. Sa kaninong doktor po?
Kaninong doktor.
May doctors po. Iba-iba, di ba? Iba-iba po yung mga doktor. Dadalhin lang po sila doon, tapos, iba-iba na po yung doktor ng mga tumitingin.
Okay. So, ang issue dito yung pagkukuha ng seekers o taong iikot-ikot doon sa mga barangay at pag nakakita, usually pa naman senior citizens, pag nakakita ng bukang potential, kakausapin at ikukumbinsi sa clinic. At doon sa clinic, i-examine and then i-opera nila. Let's get to the basic question I'd like to ask, no. Dr. Noche, you're with the Philippine Medical Board. Why is it a basic question para malaman ng lahat? Bakit nga naman ginagawang unethical yung pag-advertise ng services? Bakit nga naman pagmamarket ng services ng doktor at bakit unethical yung pagkukuha ng paghahakot? Would you be able to, or if anyone would be willing to answer, no? But maybe Dr. Noche?
Well, as far as the code of ethics is concerned, bawal po yung naghahakot ng pasyente to a particular health facility. Ang major concern ko dito, kasi kami, we certify professionals and we also classified the doctors available in the country. May generalist, yun fresh from board exam. May specialist, yun after board examination, kumuha ng training sa particular field like ophthalmology. Tapos, in-examine sila ng Society Board, ang tawag namin specialist. And then, of course, subspecialist. Ang concern ko, Senator, dito, bakit maraming binibigyan ng PhilHealth na hindi certified doctor, certified ophthalmologist?
Teka po. Let's not jump to other issues. Ang issue lang muna is, bakit, basic lang, nakalagay na sa batas noong 19 na bawal ang solicitation ng doktor. Bawal ang doktor na mag-market ng services niya. Bawal ang doktor na humakot ng pasyente. Akin, alam na natin nakalagay sa batas na humakot ng pasyente. Ang akin, alam na natin nakalagay sa batas. Pero talagang masama dyan. Dr. Kamalig, I see you.
President of the Philippine Medical Association. Especially here in the Philippines, we have such a paternalistic culture. Bahala na kayo, doktor. Ikaw yung doktor, ikaw din yung anong tawag dito? Nagsasabi sa pasyente na kung anong ibibigay mong care, and yet, ikaw pa rin ang pwedeng kumita dun sa sinasuggest mong procedure. Diba? Because you might be earning from, let's say, a lens or shall we say, medicines or yung mga equipment that you own. So there is an ingrained moral hazard that actually takes place. So, ito nga yung reason kung bakit bawal kang mag-advertise. Kasi, ang gusto natin, equal ang playing field for all physicians and hindi magkakaroon ng undue advantage for those who might have more money to advertise than physicians who might be less equipped to do so. So, yan po ang kailangang maintindihan ng lahat.
Thank you so much, Dr. Kalimag. Dr. Evangelista, yung issue po ng seekers.
Yung pong issue ng seekers, kagalang-galang na senador, kailangan po nating nang sagutin ng ang QCI Center yan ngayon na. At ang sagot po namin doon, hindi po kami nag-i-employ ng seekers. At sigurado po ako na yung audit at yung PhilHealth walang mahanap dahil wala po kaming ginagawang ganun. Ang disenyo po ng aming eye center ay simple. Kami po ay nagpo-provide ng facility at equipment para sa mga doktor, para doon nila dalhin yung mga pasyente nila. Ang nagdadala po ng pasyente sa amin ay yung mga doktor. Ganun po kasimple yung aming design. Open center po kami, lahat po ng doctors na qualified, basta graduate sa residency training program, pagkatapos na-recommend ng ibang mga kakilala na namin, meron silang PRC, meron silang kung ano-ano pa, na pumasa sila doon sa credentialing, tinatanggap po namin sila para makapasok. Ang totoo po nun, yung QCI Center po, mahigit pong 100 doktor ang tumatangkilik po dyan simula pa po noong 1997 hanggang po nung natigil kami itong May 22 dahil dito sa nangyaring ito.
Senator Pimentel?
QCI Center, kayo po ay physical premises lamang?
Yes po. Yun po ang design ng aming eye center simula pa doon.
So 100 doctors gumagamit doon, rotation sila, hindi pwedeng sabay-sabay. Definitely, right?
Ini-schedule po namin kasi po hindi po sila pwedeng magsabay-sabay. Meron pong halimbawa pupunta ron mag-o-opera. Meron pong pupunta doon gagamit ng laser. Meron pong iba doon magpapa-angiography lang ng pasyente.
Anong relationship niyo po ng QCI Center sa individual doctor?
Visiting,
nagbabayad sila ng renta?
Nagbabayad po sila doon sa gamit ng facility namin. Ngayon, kung yun pong procedure na gagawin nila, for example, ay covered ng PhilHealth, ang maganda po doon sa center namin, hindi na kami nagcha-charge above that for the payment of the facility. Yung pong doktor pwede pong sumingil ng mas mataas pa kaysa sa PhilHealth kung gusto niya kasi professional fee niya po yun eh. Pero yun pong sa amin, sa party namin, pinagkakasya po namin yung allocation ng PhilHealth doon sa bayad ng facility At yun lang po ang sinisingil namin.
So sa mata ng PhilHealth system, kayo yung facility. That you are the facility billing PhilHealth and you are the facility being paid by PhilHealth. Kayo po yun?
Yes po, Your Honor. Opo.
Attorney Padilla, you've seen the setup. Is that allowed?
Hindi ho, dahil ho ang binabayaran lang ho ng PhilHealth ay yung facility mismo. Ang facility ho mismo ang nagbabayad sa mga doktor. Ang nagpa-file ho ng claim sa amin is the facility, not the doctor. So talaga ho, ang bayad ho namin diretso sa facility and therefore they are responsible. At babanggitin ko ho ulit yung nabanggit ko kanina, yung may kaso ho, no? Na malinaw ho whether visiting ka, consulting physician, or consultant or whatever capacity, it's the facility who is responsible for the outcome of anything that transpires or negligence committed by the doctors.
In other words po,
Sa hospital ho yan.
in other words, yung binabayaran ng PhilHealth, hindi yung doktor, kundi yung facility kung saan.
Opo.
Facility nagtatanansak sa inyo eh.
Opo. Sila rin po nagpa-file ng claim.
So, for the right to transact with you, they're subject to your rules and regulations.
Correct.
Ganun
Tama.
kaklaro.
Tama ko. Malinaw ho yan.
Klaro sa kanila yon.
Well,
nagpirmahan kayo ng...
Sa tingin ho namin, klaro, nasa performance commitment rin ho namin yan, that the facility is severally and jointly liable together with the doctors who are part of that facility.
So, Dr. Evangelista, you do recognize that you signed an undertaking that you will be responsible for the actions of your doctors. Please speak into the mic. Yan.
Kagalang-galang na Senador, ang accreditation po ng facility ay hiwalay po sa accreditation ng doktor. Ang totoo po nun, bago po 2011, ang bayad po ng PhilHealth ay hiwalay yung bayad niya sa facility at hiwalay yung bayad niya sa doktor. Magkaibang cheque po yung direksyon nun. May dumadating pong cheque sa amin, tapos yung doktor, sa kanya napupuntang account yung sarili niyang cheque.
Teka, sandali. Yung cheque na bayad ng PhilHealth, in other words, dalawa.
Dalawa po, dati, before 2011.
So, kunyari, Dr. So-and-so,
yes.
At tapos Quezon City Eye Center.
Yes, magkahiwalay po yun ng 2011. Ngayon po, noong 2011, ginawa pong policy ng PhilHealth na lahat ng cataract surgeries, lahat ng bayad sa doktor, padadaanin po sa amin at kami po ang mag-aabot do sa doktor. Natural po, yung reimbursement po sa amin, lolobo. Kasi po pinadaan po sa amin pero hindi naman po amin yun eh. Yun po ay nakasulat din po doon sa voucher nila. Ito ang inyo, ito ang sa doktor, ito ang tax nito, iabot ninyo. Ganun po yun. Noong 2011 po yun. Mas malala pa ho noong 2013. Kasi noong 2013, hindi lang po yung cataract surgery ang pinapaabot sa amin. Lahat po ng professional fee. Laser, glaucoma surgery, retina surgery, yung angiography, lahat po ng professional fee na yon, ipinadadaan na po sa center para iabot namin sa doktor. Kaya po nung tinignan namin yung aming mga figures, yung palang paglobo, hindi naman po pala dahil sa talagang tumataas yung aming reimbursement, kundi pinadaan po itong mga perang ito doon sa amin para iabot po doon sa doktor. Yan po ang totoo at palagay ko po pag ni-review nila ulit yung audit nila, makikita po talaga nila yung mga numerong yun. At hindi po namin employees yung mga doktor, Your Honor. We don't employ doctors. Ang relationship namin is strictly, you are visiting, you are credentialed, you may use our facilities. 1 or 1,000 kayo, you're welcome with us for as long as you're qualified.
And you don't have an undertaking that your facility will be responsible for the actions of the doctors?
Wala po. Ang sinasabi lang po namin, sumunod sila sa batas ng PhilHealth, ng ethics, ng PMA, at sa batas ng bansa. Yun lang po ang nakasulat sa aming agreement with our visiting doctors. At pumirma po silang lahat doon.
Attorney Padilla?
Po, part of the performance commitment ho ng Quezon City Eye Center dated December 15, 2014, yung number 5 ho na nakalagay ho doon, that as responsible owners and managers of the institution, we shall be jointly and severally liable for all violations committed against the provisions of 7875, including the implementing rules and regulation and PhilHealth policies issued pursuant thereto. Tapos ito ho, yung binabanggit ko rin hong kaso na nakalagay ho dito, ang sabi ho ng Korte Suprema, ito ho, no? I'm quoting, the right to, in assessing whether such a relationship in fact exists, the control test is determining. Accordingly, on the basis of the foregoing, we rule that for purposes of allocating responsibility in medical negligence cases, an employer-employee relationship in effect exists between hospitals and their attending and visiting physicians. This will, of course, apply to eye centers, no? Kasi sila po ang institution.
Supreme Court decision po yan?
En bank ho, wala hong dissent. This is the case of Professional Services Incorporated versus Natividad Enrique Agana, GR number 126297.
En bank tapos walang dissent?
Wala ho.
Okay. Dr. Evangelista, do you have a certain Dr. Ramon Fontanilla in your center?
Yes, we do, Your Honor.
Dr. So, could you recount in your report what the activities of this Dr. Fontanilla? Okay, of course. There's a certain Freddy Peralta cited.
Sorry, maraming
May I speak, Your Honor?
Yes, while we're waiting for Dr. So, Dr. Raymond Evangelista, you are recognized.
Kung meron pong problema sa mga doktor, iba't ibang doktor, hindi naman po isang facility lang ang pinupuntahan ng mga doktor na yan. At dahilan naman po sa hiwalay ang accreditation ng doktor sa facility. Kung mamarapatin po sana ng PhilHealth, ba't hindi po nila suspindihin na lang yung accreditation ng suspiciosong doktor na yon? Sa halip na suspindihin yung facility. Kasi po, kung ang facility, pagpalagay na natin, merong 100 doktor na gumagamit sa kanya. At isa po doon, yung pinagsususpetsahan nila. Hindi ko po maintindihan kung bakit kailang isuspend yung facility na ang talaga namang kailangang pagtuunan ng pansin ay isa o dalawa lang.
Dr. Padilla?
At pumupunta din po siya sa ibang facility kasi.
Okay.
Opo.
Okay, tapos na po kayo? Okay.
Ibang usapin naman po yung accreditation ng mga doktor from the accreditation of the facility. I mentioned also earlier na meron ngang isang doktor na nasuspindi ang kanyang accreditation, pero siya pa rin ang gumagawa sa isang facility using the name of another doctor. No? So, bawal rin ho yun. Pero ang punto rin ho dito is that hindi ho namin sinususpend yung pagbabayad namin sa mga eye centers dahil sa doktor. Sinususpindi ho namin yan dahil nga sa mga violations from their performance commitment, yung paghahakot, yung mga iba pang mga napansin, no, o nakita mga violations. At dahil ho doon, yun ho ang naging resulta. At ito nga ho, jointly and severally ho ang kanilang liability or solidarity po ang kanilang responsibility dun sa mga nangyayari ho.
Did you say solidarity?
Jointly and severally ho is the term that we use, or solidarity liability.
Jointly and severally was what was written in the undertaking.
Correct, tama ho. Tama ho.
And then coupled with the Supreme Court decision. Senator Pimentel.
Hindi, mabuti nga na shinif ni Dr. Evangelista yung focus natin to the doctors. So, bali ang tanong niya, bakit hindi yung doktor instead of the facility? Ang tanong ko naman, bakit hindi pareho yung dalawa? So, ano ang ginawa niyo sa mga doktor, yung mga top 10? May kilos kayo ron?
Opo, meron ho kaming mga pinafile na mga kaso rin laban sa mga doktor. Pero
yung accreditation nila sa PhilHealth, kasi yun yung madali nyo gawin. Like, ang dali nyo yatang ginawa lang yung pag-suspend ng payment sa facility. Habang sa doktor?
Actually, meron na ho tayong na-suspend ng accreditation ng mga doktor.
Well, hindi yung mga doktor, but yung mga konektado dito sa kasong ito, yung may mga Doctor 1 kayo, 1 to 20 yata yung sinulat ninyo. Kumusta yung top 10 na yun?
Right now ho, dalawa ang mga na sinuspend din natin payments, no? Tapos na ho yung audit sa mga may susunod pa hong dalawa na isususpend din namin. Ang punto ho namin ho dito is that sinususpend, importante ho sa amin na suspendihin yung, hindi naman accreditation, no? Sinususpend lang ho namin ang payments, hindi ho accreditation ng facility. And we are only suspending it because of the perceived violation na kinocommit ng mga doktor. So, kasi sabi nga ho namin, the one who files the claim is the facility, not the doctor. The one who receives the claim is the facility, not the doctor. No, so dapat ho responsable ang facility sa kanya-kanyang mga doktor. Hindi ho nila pwedeng gamitin yung palusot na sasabihin lamang na kasi yan ang ginagawain ng aming doktor. Hindi ho pwede yon. Otherwise, every other doctor in all hospitals would be escaping liability.
Yeah, pero si Doctor number 1 sa listahan mo, incredible na yung number of operations niya. So what is your action? Kayo finding mismo ninyo yun.
Well, ang unang action ho namin dyan, sinususpende namin ang accreditation of yung doctor and possibly even filing of criminal cases.
Yeah, ginawa na nga ba ninyo with the top 10 doctors na linista nyo na walang name?
Hindi, we've been...
Kasi yun yung point ni Dr. Evangelista, focus sa doktor. Ako focus on both. O ano, pwede?
Pwede ho yun. Wala ho problema yun. I think we are moving in that direction.
Kasi tama naman yun, you penalize because you are dealing with the facility, but the facility can only move because of people. Ultimately, tao rin ang kumikilos
kasi nga ho, pati we had an example where a particular doctor suspendido na ho sa accreditation and yet still performs in that facility itself using the name of another doctor. And we have filed.
That's a crime.
That's a crime.
We better announce it publicly. That is a crime.
That is a crime. Opo.
And you will now file the criminal complaint.
Please speak into the mic.
I think we already have. Yeah.
Okay. Dr. Padilla?
Just a clarification. Yung mga ibang doktor ho na under investigation ho, may mga 3 na yata, no? Dr. So, who have been stopped payment as well. Because some of these doctors, for example, in the top centers, they go to other centers. So what we're doing also, even their payments have been suspended. Pati yung doktor ho, hindi lang yung, kasi not just the center, not just one center, but the doctor himself. So wherever he goes, hindi ho mababayaran muna habang iniimbestiga yung mga claims ho niya. So, pati ho yung mga doktor.
So, we're clear on that, Attorney Padilla, na it's the institution plus the doctor.
Opo. But necessarily, ang nauuna namin hong is the facility. Dahil dun ho binabayaran
Dr. Noche, I see you raising your hand.
Yeah, just for clarification, by accreditation in PhilHealth means accreditation for the reimbursement in PhilHealth, whereas accreditation of the professional is under the PRC, Board of Medicine.
Under the Professional Regulatory Commission?
Yeah.
Okay.
Reimbursement would be...
Have you filed a complaint with the PRC? Attorney Padilla.
We have, Your Honor, and tama ho si Doktor, no, na talagang when it comes to the license to practice, sa PRC ho yan. So, yung accreditation ho namin is over and above that licensing dahil nga the right to receive reimbursements naman from PhilHealth. Tama ho yan.
Okay, Dr. So. Okay.
Thank you, Your Honor, for your patience po. Audit observation number 2 from our interim audit report reads, results of the domiciliary and facility visits aimed to verify the outcome of cataract operations of patients from Quezon City Eye Center showed that the facility's mode of recruitment are through tie-ups with local government units, senior citizens group, free screenings as well as house-to-house visits. The seekers, who are named Sally, Freddie, and Nurse Julie, respondents who were interviewed during the domiciliary and facility visits confided that they were recruited by a person named Sally. One of the responded patients from Navotas recalls that Sally would usually search for patients in their area who are PhilHealth members and offers a program for cataract surgery. Sally brings patients to Quezon City Eye Center to undergo cataract surgery. In this case, Sally accommodates only those patients who have PhilHealth memberships. Patient testified that he was convinced to go with Sally because she provides free transportation in going to the facility and back home. Another recruiter, whose name is common to the patient, is a person named Freddie. No? A patient from Caloocan narrated that this person acts as a coordinator to a group of senior citizens in the area. He coordinated with the president of the senior citizens group and usually performs house-to-house visits and offers free cataract surgery. Freddie provides free transportation and brings patients using a service vehicle to the clinic and residence of Dr. Ramon Fontanilla at East Avenue, Quezon City for a free eye screening, and thereafter patients are brought to Quezon City Eye Center for cataract surgery. Do I go on, Your Honor? Moreover,
Tapos na yan sa...
meron pa po.
Sige. Proceed.
Moreover, during the facility visit of our auditors, a patient also revealed that she was recruited by a certain Julie. Julie is a clinical staff of one of the affiliated ophthalmologists of the facility. Nurse Julie coordinates with the officials of the Quezon City government and stations herself in one near the City Hall. They perform free eye screening with the use of a simple flashlight and gives flyers containing her cell phone numbers, and a map going to Quezon City Eye Center. So, the recruitment activity of Dr. Ramon Fontanilla. Another patient in Caloocan testified that he joined a group of 10 to 15 patients who were recruited by Mr. Freddy and offered free eye medical mission and consultations at the residence of Dr. Fontanilla. Only patients who have eligible PhilHealth membership are allowed to join the medical mission. They were provided with a service vehicle by the doctor himself. After the eye checkup, Dr. Fontanilla scheduled them for a cataract surgery at Quezon City Eye Center. Dr. Fontanilla gave 50 pesos to each patient as transportation fare in going to the eye center. After the surgeries, patients are also offered free snacks. There are other findings pa po. Or
yes, but let's go to just seekers. Ito ba, yung other finding mo, seekers din?
Other modus po of their tie-ups po.
Tie-ups with local government units. Let's give Dr. Evangelista a chance to respond.
Your Honor, we don't employ those people. We don't know them. We don't talk to them. And I'm sure if the audit team were able to talk to them, they will say they have nothing to do with us. We have nothing to do with them, Your Honor.
Pero may mga pangalan, ano? Nurse Julie, Dr. Marcy Marjorie Chan. Is this Dr. Marcy Marjorie Chan connected with your facility?
Nagbi-visit po siya sa amin. Pero by their own words, Your Honor,
yes,
yung mga tao na nagdadala o naghahakot daw, they don't bring the patients to us. They bring the patients to the doctors. Now, I know this may sound a little, technicalish or kung ano man, but kung ano po yung ginagawa ng doktor sa labas ng premises namin, mahirap po naming imbestigahan yon. Kami po, ang mga tauhan po namin, puro mga nurses. Wala po kami investigador doon. Hindi limited lang po yung capability namin eh. We are a facility. At pumipirma po sila. Pwede ko po bang dagdagan, Your Honor?
Go ahead.
Kasi po, nagkaroon na po ng malaking problemang ganito. Parang balikan na po kami ng PhilHealth dati pa noong 2011. Noong 2012, meron po silang ginawang bagong policy. Ang policy po ganito. Bago kami mag-allow ng doktor na mag-opera ng katarata sa amin, meron pong fill upan na form yon. At dun po sa form na yon, i-declare niya kung yung pasyente, paano siya na-refer, paano niya nakuha, kung gagawin ba siya sa mission. Pipirmahan po ng doktor yon. Pagkatapos, yun pong papel na yon, ibibigay po namin sa PhilHealth para i-evaluate po nila. Meron po silang 7 days para i-evaluate yon. Ngayon, sila po ang mag-a-allow o magdi-disallow nun. Depende kung gaano kataas yung pagsuspecha nila siguro o gaano tingin nila kung tama ba o mali yung nangyayari, sila po ang nag-a-allow. Pag ibinalik po sa amin yung papel na yon at sinabing disallowed, sasabihin po namin sa doktor, hindi mo po pwedeng operahan yung pasyente mo.
Ano po ang tawag doon sa papel na yon?
Cataract pre-surgery authorization.
Pre-cataract surgery.
Yun po nung 2012 po yun. Sa makatwid, bago po namin ina-allow yung doktor na mag-opera sa amin, dumadaan po siya sa scrutiny ng PhilHealth at sila po ang nag-a-approve. Kung nagsususpecha po sila, ang PhilHealth, na meron palang ginagawa itong mga doktor na to, maaari naman po nilang i-disallow siguro yon para hindi matuloy yung operasyon.
Okay, thank you. Before we let Attorney Padilla answer that, Senator Ejercito?
Thank you, Mr. Chair. Just to clarify on that issue, I'd just like to ask Attorney Padilla. So, Dr. Evangelista said that prior to, bago ho nila operahan no, ang isang pasyente, they would need a pre-cataract surgery authorization from PhilHealth. Tama ho ba?
Oh, yeah.
So ibig kong sabihin na kailangan nyo po ng pre-approval no, ng bago nila operahan ang bawat pasyente.
It's a pre-authorization ho. Hindi ibig sabihin ho yun na once binigay namin ay garantisadong valid o tama yung kanilang ginawa sa cataract. Nandun rin ho sa pre-auth that it is not a condition no, or a guarantee.
Yes, Dr. Padilla, please.
Can I say something? No? It's yung pre-authorization ho na yon, yung na ginawa ho noon parang as a means to try to screen no, yung mga pasyente. Admittedly ho, it's based on an honor system. The doctor has to be honorable and honest in filling up the form. Okay? Now, it's a form that says the patient, how did the patient go to you? Referred, walk-in, wala naman ho nakalagay recruited. Okay? Others. Ano ho yung vision ng pasyente bago siya na-operahan? A doctor can always say, malabo na, although 2020 pa siya. It's an honor system. Now, that's why, however, we realize that also. No? Now, that means that just because the doctor does that, it's not without prejudice to being investigated later on. And this is what the audit team has used it also for, as a post-audit. So you can see there, sabi nyo, walk-in, sabi nyo, ganyan. Tapos tinanong yung pasyente, paano nyo nalaman ito? Kasi ni-recruit ako. So that's already a fraudulent form. There's already something wrong with the form. So basically, that was the use. Now, with the new, again, as the DOH representative, we're looking into these systems also, how we can better improve them, no? But yun ho ang nangyari ho dun sa pre-authorization. To also know kung yung pasyente ay covered ng PhilHealth, isa rin yun. It's, things like that, no?
Okay, thank you. Dr. So, let's move on to your audit findings in the Pacific Eye Institute. Page 4. Please read it. Yes, read it. Yung letter A. Audit observation number 1.
Audit observation number 1, suspected breach of warranties on the provision against solicitation of patients. Dr. David Harold Goseng Fiao, owner of the Pacific Eye Institute, admitted in an interview with the audit team that he is paying Ms. Yolanda Nicolas 20,000 pesos per month to conduct marketing activities. In particular, Ms. Nicolas is gathering people provided that they are PhilHealth members or dependents to bring to Pacific Eye Institute where they can receive treatment for cataract without any out-of-pocket spending. She conducts house-to-house visits and creates linkages with local government units and other marginalized groups to seek prospective PhilHealth members that would undergo eye procedures. Ms. Nicolas's actions and the manner she recruits prospective patients, of course, puts into question the motive. If Ms. Nicolas intends to seek patients needing care, does she have the training and expertise to determine indeed if patient's conditions require surgery? So, results of the domiciliary and facility visits aim to verify the outcome of cataract operations of patients from Pacific Eye Institute showed that some of the patients' mode of referral was through enlistment or recruitment of a particular staff of the clinic.
I think we can stop there. Dr. Gosing Fiao, you admitted that you pay for marketing, brokering?
Magandang umaga po, mga mahal na senador. Ako po ay nagpapasalamat sa inyong imbitasyon lumahok dito sa Blue Ribbon Committee hearing. Ako po si Dr. David Gosing Fiao, scholar po ako ng bayan mula sa Philippine Science High School hanggang sa pagka-doktor sa UP Intermed at sa pagka-specialista sa ophthalmology ng UP-PGH. Sa awa ng Diyos, nakatungtong din po ako sa Massachusetts Eye and Ear Infirmary ng Harvard Medical School para sa aking clinical fellowship. Umuwi po ako ng Pilipinas upang ipamahagi ang mga natutunan ko sa aking pagkadalubhasa at makatulong sa ating mga kababayan. Naniniwala po ako na ang kalusugan ay isang karapatan. Bilang isang Pilipinong ophthalmologist, sinikap ko po na makapagtatag ng institusyon na makapagbibigay ng dekalidad na serbisyo sa pasyente kahit pinakamahirap na Pilipino. Ito po ang Pacific Eye Institute sa Makati. Tatlo po ang layunin ng PEI. Number 1, provide all Filipinos access to modern eye care. Number 2, provide doctors with access to relevant modern technology. And number 3, advance the state of ophthalmology in the Philippines. Upang maisaad namin to, tinanggal po namin ang mga hadlang sa quality eye care. Tinanggal po namin ang mga cost of service delivery ng mga doktor tulad ng rent, staffing at equipment. Ang mga pasyente naman ay binigyan namin ng impormasyon at tinanggalan ng cost of service barrier. Libre po yung patingin namin sa Pacific Eye Institute. At wala pong kulang ang patingin sa Pacific Eye Institute bagamat libre. Dumadaan lahat ng pasyente sa iba't ibang stasyon ng pagsusuri. Kung may dudang doktor sa diagnosis ng pasyente, nakakasiguro sila sa pamamagitan ng mga special test tulad ng ultrasound biomicroscopy, B-scan ultrasound, FDT, perimetry, photography at mga laser scanner tulad ng HRT at OCT. Libre din po ang pagsagawa ng mga mamahaling eksaminasyon na to, bagamat hindi po sila binabayaran ng PhilHealth. Nakakaya po namin ibigay lahat ng ito ng libre dahil ipinagkakasya po namin para sa lahat ng serbisyo at kagamitan ito ang mga binabayad ng PhilHealth para sa mga procedure na ginagawa sa aming center. Kami po ay sumusuporta sa no balance billing, hindi lang sa indigent, kundi po sa lahat. Hindi po kami pumipili ng pasyente. At sa tingin ko po, ito po ang pinakamaunlad sa lahat ng mga PPP, Public-Private Partnership. Nagtiwala po kami na pananagutan ng PhilHealth ang mga serbisyo namin para sa ating mga kababayan, kaya malakas ang loob namin na ipauna ang lahat ng gastusin ng mga operasyon. Kung titignan po natin ang natipid ng bawat pasyente sa Pacific Eye Institute, hindi po nakapagtataka kung bakit dumami ng husto ang mga pasyente. Pangkaraniwan po nakakatipid ang isang pasyente ng 38,150 pesos sa bawat operasyon ng katarata kung ihahambing sa ibang pribadong klinika. At dahil masaya ang mga pasyente namin sa mga naging resulta, sila na din ang nagsasabi sa iba tungkol sa PEI. Pati mga pasyente na napresyohan na ng mata sa ibang klinika ay lumilipat na sa PEI. Hindi naman po kami makakatanggi dahil kalusugang pangkalahatan ng aming mithiin. Kusa na po kaming pinapatawag ng iba't ibang organisasyon tulad ng mga Senior Citizen Group at LGU upang magbigay ng kaalaman tungkol sa mga serbisyo namin. At sila na din ang nag-oorganisa ng mga miyembro nila na nagnanais magsadya sa PEI. Naniniwala po ko na malaking tulong ang ginagawa namin, lalong-lalo na sa mga nangangailangan. Sa taong 2013 at 2014 pa lamang ay halos 300 million na ang suma total na natipid ng mga pasyenteng nagpapa-opera ng katarata sa PEI Makati. 300 million po ang suma total na gagastusin nila sa ibang klinika kung wala ang Pacific Eye Makati. Kaya naman po, ganun kalaki din ang gulat ko nung i-presscon kami ng PhilHealth noong Mayo 22. Tinawag po nila kaming huwad at ininigil ang pagbayad sa amin nang walang abiso. 4 na araw po bago binigay sa amin ang mga audit findings at stop claim memo, kahit araw-araw naming hinihingi mga ito. Pagkabigay po na to, Muli po kaming siniraan sa media ng internal audit kahit hindi pa kami nakakasagot sa mga findings. Tinawagan at tinext din ng iba naming mga pasyente para humarap sa media. Yung audit findings po binigay naman po yata ni Dr. So sa inyo. Wala naman pong legal definition ang solicitation o seeker. Subalit ayon po kay Dr. Robert So, VP ng Internal Audit Group, at makikita din po sa audit findings, ang ginamit na besahan ng unethical recruitment ay ang Code of Ethics ng Philippine Academy of Ophthalmology nang dahil sa Memorandum of Agreement nila dito. Nais ko pong linawin na hindi kami naghahakot ng pasyente. Tungkol naman po sa definition ng PO, hindi naman po sakop ng PO ang mga institusyon. Napakadaming mga institusyon na nag-advertise at nagpo-promote ng kanilang mga serbisyo. Kasama na po ang institusyon na kinabibilangan mismo ng presidente ng PO. Ito po yung flyer ng Pacific Eye and Laser Institute na itinatag ng presidente ngayon ng PO. Eksakto po kung anong binabawalang PO Code of Ethics na solicitation, ginawa nila. May flyer, may tie-up sa LGU, may tie-up sa NGO, may free eye screening. Ligtas po yan dahil ang institution po ang Pacific Eye and Laser Institute at hindi siya ophthalmologist. Ayon po kasi sa 2012 IRG ng PAO Code of Ethics, bawal ang unethical recruitment activity, and it is defined as follows: an organized activity wherein an ophthalmologist, individual, or a group of ophthalmologists, individuals, recruits patients systematically through various means of solicitation, such as but not limited to advertisements, free eye screenings, house-to-house visits, tie-ups with local government units or NGOs or senior citizen groups, etc., for the purpose of doing eye surgeries only on patients with PhilHealth benefits. Ayon naman po sa 2013 IRR ng National Health Insurance Program, ito po yung Declaration of Principles and Policies. It is hereby declared the policy of the state to adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all the people at affordable cost and to provide free medical care to paupers. Toward this end, the state shall provide comprehensive health care to all Filipinos through a socialized health insurance program that will prioritize the health care needs of the underprivileged, the sick, and the elderly, persons with disabilities, women and children, and provide free healthcare services to indigents. Ang tanong ko po ay bakit itinaguyod ng PhilHealth ang isang code of ethics na kontra sa kanilang prinsipyo? Ang totoo po dyan, dati-rati, hindi naman po issue ang unethical recruitment. Kaya lang po noong 2007, pinilit ng Philippine Academy of Ophthalmology na ipagbawal ng PhilHealth ang mga mission at ang recruitment ng nalabag sa code of ethics ng PO. Ginamit po niyang PhilHealth upang isabatas ang Code of Ethics ng PO. Ang sabi po nila, now we have teeth to police our ranks. Bumuo din po ang Board of Directors ng PhilHealth kung saan nakasama ang presidente ng isang tanyag na eye center noong panahon na yon, ng Task Force Kisap Mata. Ang kaisa-isang tungkulin nito ay habulin lahat ng nagmi-mission at unethical recruitment activities base sa Code of Ethics ng PO, sapagkat lahat ng ito daw ay fraud. Sa tingin ko po, iyan din ang ginagawa nila ngayon. Ang tanong po dyan ay, ano nga ba talaga ang batayan nito ng fraudulent claim? Sa palagay ko po, ay hindi naman dapat nagpagamit ang PhilHealth sa ganitong paraan. Parang naging batas na po ang ethics ng PO. Kahit kailan, pwede po nito baguhin ang kanilang Code of Ethics at parang gumawa na sila ng bagong batas. Sa aking kalaman, Kongreso at Senado lamang ang maaaring gumawa ng batas. Maari din pong gumawa ng Code of Ethics na labag sa mga prinsipyo ng PhilHealth at magkaroon ito ng tibay ng batas. Sa palagay ko po, ito na nga ang nangyari. Mabuti po at naipasa na ang Philippine Competition Act dahil ngayon maari ko na sabihin na sa tingin ko ay anti-competitive po ang pagbabawal ng mission at mismo ang Code of Ethics ng PO. Sa Estados Unidos po, itinanggal na ng gobyerno ang pagbabawal ng solicitation sa mga samahan ng doktor. At sa tingin ko po, labag po ito sa Administrative Order 179, Series of 2004, the National Prevention of Blindness Program ng DOH, kung saan sinasaad ang partnership between stakeholders, provide access for all to quality eye care, intersectoral collaboration on eye health promotion and urgency of early diagnosis and management. At sa tingin ko din po, anti-poor ang ipagbawal ang libreng patingin at ang pakikipag-ugnayan sa mga LGU at NGO. Higit sa isang buwan na po ang nakalipas at hindi pa din kami makasagot na maayos sa audit findings sapagkat hindi pa rin kami nabibigyan ng mga detalye o bill of particulars. Ganun pa man, masasabi ko po na nakasunod kami sa mga alituntunin ng PhilHealth at DOH. At lahat ng rekomendasyon at serbisyo ng aming mga doktor ay base sa professional expertise nila at para sa ikabubuti ng pasyente. At huli po, hindi po tugma ang mga datos ng PhilHealth sa mga datos namin tulad ng Quezon City Eye Center. Ayon po sa datos na binigay ng PhilHealth, nakapagpasa ang Pacific Eye Institute Makati ng 11,635 claims na nagkakahalaga ng 169 million noong 2014. Base naman po sa mga records namin, 7,507 claims lang ang pinasa namin noong 2014 at nagkakahalaga ito ng 106,582,520 lamang. 2,309 claims po na nagkakahalaga ng 62,914,240 ang hindi nanggaling sa amin. Ito po bang tinutukoy ng 2 billion scam o fraud? Kung pagkakamali lang po ito, ano po ba yung totoong datos? Ipakita na dapat ng PhilHealth lahat ng datos sa buong Pilipinas, sa lahat ng procedure at sa lahat ng institusyon, hindi po yung piling-pili lang. Sino po ang mananagot sa maling datos na naging pagkasira ng aming reputasyon? Napakahirap po ng dinadaanan namin ngayon. Nasira po ang pangalan namin at tinigil ang pagbayad sa amin. Hirap po kaming magbigay ng tamang serbisyo sa mga kababayan natin. Napakarami po ng mga senior ang nag-aantay ng serbisyo, kaya lang po, hindi lang po kami, lahat ng no balance billing eye centers ay tinarget na ng PhilHealth. Wala na po silang mapupuntahan. Nawala na ang tiwala na napakahalaga sa mga magkatuwang. Walang fair play, walang due process, abuse of authority, trial by publicity, at anti-competition ethics ang umiiral. Tulad po ng ginagawa namin ngayon, handa po kaming humarap at dumaan sa tamang proseso. Handa po kaming tumulong sa anumang investigasyon at hinihiling lang namin po ay fair play. Walang abuse of authority, walang trial by publicity at walang prejudgment. Walang anti-competitive ethics. Nais po naming mapawalang bisa ang stop claim order at matigil ang paggamit ng Code of Ethics ng PAO bilang basehan ng PhilHealth para itigil ang pagbabayad. At ayon sa aming karapatan ay bayaran ng PhilHealth ang mga legitimate claims. Hinahangad din po namin na maibalik sa tamang direksyon ng PhilHealth ang mabigyan ng advanced eye care ang ating mga mahihirap na kababayan na tunay na nangangailangan. Ito po ang ultimo naming layunin. Maraming salamat po.
Thank you, Dr. Gosing Piao. One clarification, Attorney Padilla. Yung sinasabing pag-solicit, labag po sa batas yan?
Labag po yan sa Philippine Medical Association, in Act. Labag rin po yan dun sa mismong Medical Act.
So it's a violation of law.
Opo.
It's not just a violation of a code of ethics
Opo.
imposed by a private association.
Opo. Tama ho yung sinabi na siguro sa Estados Unidos ay niluwagan nila to o binawasan nila. Kaya lang, ang problema ho natin is nasa batas pa ho natin yan ngayon. At naibigay na ho yata ni Dr. Kalimag ang kanyang mga dahilan kung bakit pinagbabawal ho ang solicitation or advertisement. Dahil isa hong hindi natin maiwasan na problema ho dyan is that once you start to solicit, ang pangunahing iniisip mo ho ay kung paano kumita. Hindi ho kung paano makakatulong. Yun ho ang aming palagay, no? Na talagang once you start doing this, nagiging uniform na ho yan, nagiging institutionalized, at talagang meron darating na mga ehemplo na talagang nagiging labag sa which we already mentioned, no? Kaya nga ho, magkaroon lang isang mabulag ho dahil ho dito, ay it's already one blindness too many as far as we are concerned.
Thank you, Dr. Padilla.
Something about solicitation and advertising. It's not really wrong to advertise that may doktor dito na gumagawa nito. Walang problema ho yun eh. Nandito ako, gumagawa ako ng Ang nakikita ho namin nakakatakot na problema ngayon is itong mga nagsusulisit, may mga ibang doktor, parang ipinaubayan na nila sa mga soliciting agents ang kanilang practice. In fact, nagiging parang mafia na ho sila. Okay? We're seeing it already. Kunyari, may doktor dito sa area na to. Lalapitan na ho yan ng mga seekers. Sasabihin, malakas ako kay Mayor, malakas ako sa ganito. Magdadala ako ng pasyente sa'yo, guaranteed itong ganun kadami sa senior citizens group. Basta babayaran mo ako ng ganito, ganito, ganito. That's what's very scary. Because these people now are not ruled by the doctor-patient relationship. They're ruled by money. Business na ho. Ang mas nakakatakot pa nito, meron na kaming hawak ngayon ng mga terms of reference na tinatawag. Terms of reference from the seekers. One is they're not even legitimate businesses. I'm sure they don't pay taxes. Ang terms of reference ho, runs this way. Kami magdadala ng pasyente sa inyo, this many. Kami mag-fill up ng PhilHealth forms para sa inyo. No? Kami nang bahala magpadaan ng PhilHealth forms. Babayaran kami ng center, ganito ho, kagrabe. 6,300 bawat cataract sa center. Pero sila na ho magsusupply ng mga gamit. Lente, ilalagay sa loob ng mata, mga gamot. And most likely ho, itong mga ganito ho, ang gamit ho nila ay hindi ho FDA approved. They're usually mga bogus. So that already puts the patient in danger. The nightmare, and then sasabihin pa na sa center, bawat pasyente, 6,300 sa center, 1,000 sa doktor. Ano na may iwan dun sa quality care? So it's a syndicate. Kung sasabihin ng doktor ang center, ayaw namin makipag-deal sa inyo, sasabihin nila, pupunta na lang kami sa iba. It's like a mafia. It's like a tong system already. It's a syndicate already. And we have to stop it now. That's why we want tough laws like in the US. Okay? The way it was there. Now, ito yung Department of Health nightmare na sinasabi na imagine na papunta ka sa doktor, syempre nagtitiwala ka, bahala kayo sa doktor, whatever is best. Imagine kung yung doktor, ang iniisip niya, kailangan kong bayaran ng mga sindikato. Kahit hindi mo kailangan, sige, operahan na natin. Kasi otherwise, mawawala yung aking supplier. Kasi hindi ko siya mababayaran. It has become like that in many places. I'm not talking about these eye centers. I don't know how they operate. I'm talking about evidence from still others coming in and being given to us by nakakaawang mga doktor. Ano ho ang gagawin namin? Hindi ko namin alam ang gagawin namin. Mga sindikato na ho ito. So, that's a nightmare, no, that we have. And I'm not saying that they're doing it in Quezon City. I'm not saying you're doing it in Pacific. I'm just saying it is happening. And that's why the law, we need tougher laws. We need to recognize na nangyayari ho ito. And the Department of Health is very concerned because maybe I have statistics later about the National Health Prevention of Blindness Program, but I think I want to put things in perspective. That's why we feel it's urgent because we need to help our doctors also stay ethical and protect the sanctity of the medical profession and the dignity and the safety of our patients. That's really one very important message from the Department of Health also.
Thank you. Dr. Raymond Evangelista.
Your Honor, we strongly agree with the words of Dr. Padilla. We strongly agree that this practice should be curbed, should be stopped, and should be stopped immediately. This destroys the practice as a whole. This destroys the integrity of the ophthalmic community. This destroys the reputation of facilities. This destroys everything. The respect that the patients, yung respeto po sa amin ng mga pasyente, respeto sa mga facilities, kung paano yung pananaw nila sa mga sakit sa mata, nasisira po dahil doon sa mga aktibidades na ganun. We strongly agree with Dr. Padilla.
Yes, Dr.
One last
Padilla.
statement. Thank you very much for that because I think Dr. Kalimag, Dr. Noche, nobody here who's a physician can say or can deny that this is it's a greatest threat actually to our practice if we let this go on. And PhilHealth has the power to curb and to change behavior. It has changed behavior already. And if I'm given a chance later, I can show we're not just talking about ophthalmology, other forms of fraud in other specialties that we are now watching and trying to curb. And yun nga, if we do not do anything, then we will be dictated upon by people who do not have the best interest of the patient at heart, but only financial gain.
Thank you. Dr. Gosing Fiao, ang tanong ko kanina is...
Yes, I would like to respond to that.
Yes, please.
I just took the opportunity to, kasi po trinabaho ko ito na matagal eh.
Of course, and you notice I did not interrupt.
Thank you
we
so
let you
much
finish.
po. Thank you so much. Your Honor, Miss Nicolas po is my liaison officer. Miss Yoli Nicolas. Kaya po inadmit ko po talaga kaagad yun. I will not deny that. She's a liaison officer. And her job is, I already explained it to media and to everyone, is to liaise. No, we're often invited by LGUs, NGOs, senior citizen groups, and she goes there to explain. I wish I could present one of the pictures that I have, no, of a liaison officer talking to a meeting, no, because that's what they do. They talk to all these people in meetings. That's the most efficient way to do it. And they liaise with LGUs so that they know our services. No? And I don't think that, in a normal situation, that would be acceptable. Unfortunately nga, in-apply sa amin yung Code of Ethics ng PAO, which says that you may not liaise with LGUs or NGOs or senior citizen groups. So, naging bawal siya. So, nabahiran po kami ng fraud because sabi ho ni Dr. So na that's unethical.
Were you not aware of the restrictions in the Code of Ethics?
Your Honor, as I explained kanina po.
And in the law also. And in the law.
Yes, Your Honor. But we're an institution. No, as an institution, I think we have the right to advertise. No, I believe that the audit was conducted on an institution. So most institutions, as I explained kanina, they do these marketing activities.
What you're saying is separate the doctor. If the doctor advertises, then that's a violation of law. But if the institution advertises and employs seekers, that is not a violation of law. Is that what you're saying, sir?
Your Honor, I did not say that we employ seekers. I have a liaison officer. No, so yes, that's what I'm saying po, that advertisements is not illegal for health institutions.
Can I, Dr. So, would you please, I see you want to react.
Just one sentence po, sir, no? Because aside from the engagements in groups, Miss Yoli actually was documented to actually, some patients say that she actually did house-to-house visits as well. So it's not a group, no? It's a house-to-house
Yoli
visit
meaning Yolanda Nicolas.
The liaison officer.
The liaison officer. House-to-house visits.
They also, it was also, I'm sorry, Your Honor.
Go ahead.
Also in the findings that they went to patients that have already been consulting in Makati Medical Center, no, and offered a program. And eventually, of course, they were operated on Pacific ICEL.
Delia?
Your Honor, I'd like to just clarify, letting people know advertising per se by a hospital, they do it all the time. There's nothing wrong per se. I don't think PMA is against, for example, Makati Med saying, Makati Med is here, we have a new equipment, we have RS this. There's nothing wrong. I think the thing about the seekers themselves, what's wrong is that it's solicitation. It's not just advertising. It's going to you and saying I will bring you there for free, and these people are not even qualified to tell you have a cataract or not. And many of these seekers, because their main concern is to make money, is to get commission, iniengganyo nila yung mga tao na pumunta. Libre naman, there's usually a lot of deception.
So
This is usually,
there's a
yes.
distinction between advertising
Yes, and seeking.
and
the
seeking,
speaking.
or
Yes.
making hakot sa
Yes,
Tagalog.
it's different. Iba ho yun. Kasi may legitimate at meron naman yung, marami mga yung hindi talaga tama. No? At itong mga hakot, usually yan, kasi ang kanilang hangad talaga ho ay mabayaran per eye, hindi ho per patient per eye, nililin lang nila marami ang mga pasyente. At maraming pasyente, hindi nila alam na ooperahan sila. Akala nila lilinisin ang mata, pakikintabi ng mata, mga ganyan ang, kaya kung may mga nakikinig at sinasabi sa inyo, lilinisin ang mata, pakikintabi ng mata, lalagyan ho ng lente, pero hindi sinasabi, ooperahan kayo. Iba yung pananaw, iba yung nalalaman. At marami kami mga doktor, kung tatanungin nyo yung PAO siguro sa mga nararamdaman nila, mga nangyayari, mga pasyente, kunyari, pasyente ko, no? Inaalagaan ko. Sinabi ko, may katarata kayo, pero 2020 pa naman kayo. Pwede pang hindi operahan. Tapos, after mga 3 months darating, na-operahan na pala. Sasabihin ng doktor, na-operahan na kayo sa katarata. Hindi ho, nilinis lang ho. Kasi hindi ho sinabihan. May libre kong perang excursion ng mga senior citizen para linisin ang mata. Without knowing, cataract operation na pala yun. And the primary doctor who was advising him all along was never aware. And when he goes back to the doctor, he's also shocked na inopera na pala siya. Kasi modern cataract surgery can be done in 15 to 20 to 30 minutes depending on the skill of the doctor and on how easy it is to remove. Patak lang ho yung anesthesia. So kung talagang hindi nyo sasabihin sa pasyente at wala masyadong alam yung pasyente, madali ho makalin lang at manloko. Yun ang aming talagang, that's what we are against, that kind of a system, no? Which happens a lot. We're happening a lot nowadays.
Any other comments from our other panelists? Yes, Dr. Kalimag.
I-clarify ko lang po yung sinasabi natin na advertising. When an institution advertises, pwedeng hindi siya per se na unethical. But ang prohibition, kasi ang Code of Ethics is self-regulation. So sa PMA, self-regulation ng sa mga advertisements ng mga or clinics or kahit naka-advertise doon ng mga services ng isang clinic or isang institution, hindi pwedeng merong mukha ng doktor doon. Kasi it's a tacit parang endorsement of a certain facility. Advertisements ng mga hospitals or clinics or kahit naka-advertise doon ng mga services ng isang clinic or isang
of 1959 Code of Ethics ay sa Section 5, solicitation of patients directly or indirectly through solicitors or agents is of 19 Code of Ethics ay sa Section
Diyan, ano? Siguro magandang panahon ito dahil binanggit nga ni Dr. Evangelista sa United States. Of course, will verify. Very clear. Kini-clear natin solicitation, pero ayon sa batas may directly or indirectly. Sapagkat totoo nga naman, like kahapon, naglanding ako sa airport, unang nakita ko dun sa pagdating mo sa terminal yung advertisement ng Belo. Ng
ang pinagbabawal na ito ho no? Laging sinasabi ho sa atin na informed consent ang ginagawa sa mga pasyente. Pero kung tutusin, ako ho mismo naging pasyente nga. Nagkaroon ho ako ng operasyon. Ako, edukado na ho ako, abogado, etc. Pero kung ano man sabihin sa akin ng doktor, kung sabihin sa akin tumalon ako sa bintana, tatalon ho ako. Dahil ganyan ho ang aking belief sa mga doktor. Lalo na ho ang ating mga kababayan. Ang mga kababayan po natin, lalo na yung mga kulang ang edukasyon, mahirap, etc. Talagang kung bilib na bilib yan. Hindi lamang sa doktor, sa mga abogado, at kung ano-ano pa. Kaya ho, napaka-importante talaga na sana sa mga desisyon na gagawin, ay wag ho dapat ihahalo ang kumita sa kanyang pagiging profesional na magbigay ng payo, no, sa mga pangkalusugan ng mga serbisyo. Importante ho yun. Kasi ho, once magkaroon ho ng bayad, miski pa paano ang isang seeker, ang isang sponsor, ang tagahakot, o kung sino man, ang pangunahin hong motibo niya ay talagang pera na. Hindi na ho yung yung kalusugan.
Senator Ejercito.
Thank you, Mr. Chair. Just a few questions, Mr. Chair. Attorney Padilla or Attorney Padilla or Dr. Gita Padilla can answer. Aside from Pacific Eye and QC Eye Center, are there other facilities that are being investigated right now by PhilHealth?
Yes, opo. Yun sa top 10 natin earlier, lahat ho yun iniimbestigahan. In fact, may natapos na rin ho kaming 2 pang dagdag na eye centers na magbibigay rin kaming parehong utos na pagtitigil ng pagbayad.
So yung sa 10 na top 10 that are being investigated, as you said, sorry, medyo nahuli ako kanina, ilan po ang so far have been blacklisted or delisted?
Wala akong delisted.
Wala naman ako.
Wala akong delisted, wala rin tinanggalan na lisensya, wala rin hong tinanggalan ng accreditation.
Suspension lang ho ng payment.
Tinigil lamang ho yung payments.
While investigations are ongoing. So prior to the investigations, Attorney Padilla, how much is the liability of PhilHealth? For example, sa top 10 lang ho.
Kunyari ho, in 2013, mga 500 million ho, yung hinihinging reimbursement nung 10 lamang, no? Na ngayon ho sa 2014 it's 700 million. So ganun ho kalaki ang
they've been getting the bulk, yung top 10 talagang halos sa kanila nakakonsentrate.
Opo, ito nga ho yung pinapalabas ho namin. Ang top 10 ho namin, hindi lamang namin tinignan ng eye centers. Ang tinignan ho namin dyan ay yung ambulatory surgical centers. Ibig sabihin, meron pa ho mga iba na hindi naman eye center. Kaya lang, lumalabas ho sa retrato is that 8 or 9 out of the 10 top ambulatory just happens to be eye centers.
Also, Mr. Chair, thank you, Attorney Padilla. No? Mr. Chair, I'm also concerned with the concern of kanina maganda ho yung binabagit ni Dr. Padilla because it is correct. No? Hindi na ho yung health ang nakasalalay, parang naging mukhang more of profit na dahil nakakatakot because of these seekers. Hindi na ho ito nalalayo sa PDAP scam at iba pang scam, Mr. Chair. What can be done? Hindi ho ba yung mga doctors, you have the PRC, you have the Philippine Medical Association to protect and to look after your careers and to regulate the profession. So hindi ho ba kayo nagkakaroon ng report, do you report like yung top 10 na nakikita kanina nasa presentation na parang medyo suspicious na sa dami, no? Hindi ba ho pinupulis ng sarili ng PMA for example?
Ang saklaw po kasi ng Philippine Medical Association ay yung mga doktor. So, meron po kaming code of ethics na in fact, last May 22, we had a declaration of commitment to the ethos and ethics of the Philippine Medical Association. At sinabi na po namin doon na talagang actively we will participate in policing the ranks of the members of the Philippine Medical Association. Subalit kung hindi po namin naman nakikita yung mga numero na kagaya niyan, wala kaming means para mag-secure ng mga trends. Hindi, mahihirapan din kami actually. So unless we get feedback also from the government institutions.
Yes, Dr. Padilla, please.
Yes, Your Honor. During our last meeting at the Department of Health, where I was there and Dr. Noche was there, we met with the members of the Board of Medicine, the PRC. Among the things we discussed was a closer working relationship between PhilHealth, PRC, and the PMA, no? Because admittedly, they're not talking. So dapat ho, henceforth, talagang magkakaroon ng close working relationship para kung talagang may makita talaga kunyari yung PhilHealth, kasi PhilHealth holds the money ho eh. When you hold the money, you have a lot of power. And I think PhilHealth, with all due respect to my distant uncle, hasn't really been using its teeth adequately. And the present Secretary of Health, upon assuming position, had 2 marching orders eh. for me as the representative of the Secretary of Health and of PhilHealth is one is expand the packages like what you have done. Mas marami ng Z packages, marami na home, mas marami, no? Pero curb fraud and abuse. And one of the things we can do, and I think I agree with the Senator, is that we need to work closer together to police the ranks. Kasi kung wala ho yung doktor na papatol, wala rin hong ganito. So talagang dapat doktor ho ang may kasalanan talaga in a way. I'm very sad to say. I'm very sad because it's my colleagues, but if they did not do it this way, but siguro at first akala nila hanggang dun lang. But eventually it got out of hand. And since yung doktor at pasyente, meron kaming Hippocratic oath, we have a different kind of pananaw, pero binigay mo na, parang nisurrender mo na yung inyong practice dun sa tao na pera lang ang hinahangad. Pag ganun ho ay talagang nakakatakot ho ang pwedeng mangyari sa atin.
And lastly, Mr. Chair, I'm very much worried, and worry about your concern, Dr. Padilla. And Mr. Chair, I think there's a clear and present danger right now facing the profession, the discipline, and of the doctors, especially the ophthalmology with this exposure. I just hope, Mr. Chair, that we would continue and that the health officials would work closely with the PMA and the PRC just to make sure that, gaya na sinabi ni Atty. Padilla, talaga pag doktor nagsalita, buong tayo kahit na ibang profession natin, we entrust our lives, our health to these doctors, and we have to bring back that yung code of ethics na may balik sa kanila, of course yung discipline, and we expect always the doctors to adhere to their ethics and professional standards. That's all, Mr. Chair.
Thank you, Dr. Kalimag.
Again, Your Honor, just allow me to perhaps say some gaps that are actually happening. Ilabas na po natin. Ang isa po dito ay since 2011 or 12, tinanggal po natin kasi yung paghingi ng Certificate of Good Standing from the Philippine Medical Association. Kasi po, actually, we have a unified Certificate of Good Standing kung saan nakapirma yung specialty group, nakapirma yung Philippine Medical Association, assuming na member of good standing din sila sa component societies nila kung saan sila nakatalaga. In fact, ang tingin namin, marami sa mga nag-violate actually are not in good standing since 2011. So, ibig sabihin, hindi namin, kailangan saklaw namin kasi sila Allow me also to take this opportunity that perhaps we should be able to pass the integration bill for the medical profession the soonest time before the Senate and Congress actually recesses, because yun lang ang talagang ngipin para nang sa ganon lahat ng graduate ng MD pagsumpa nila sa PRC ay miyembro na ng Philippine Medical Association at saklaw ng lahat ng mga ethical requirements ng profession. Because also, with the pending ASEAN harmonization, kailangan din na ma-harmonize ng lahat ng 10 ASEAN countries yung code of ethics ng lahat ng mga professions before September of this year. So, magtulungan po sana tayo din doon sa ganong aspect.
Yes, thank you for those very useful inputs. Dr. Padilla?
Yes, on behalf of the Department of Health, we are also in favor of bringing back the necessity of the doctor being in good standing before he or she can be accredited by PhilHealth. Because admittedly, pareho ang observation ho ng PMA na ang dami ho sa mga doktor na gumagawa ng ganito ay wala talaga hindi sila membro na. You don't even have to be a member of the nag-resign ng PMA or ng mga specialty organizations, and they feel they can do anything kasi walang police na nagpo-police, no? Ngayon, admittedly, one of the reasons daw that PhilHealth did not anymore require it is because some specialty organizations now are abusing naman and limiting their membership based on personal agenda. So it's one of the things we are planning to do, but with some conditions also set by PhilHealth. No? So parameters that we have to discuss with the PRC and with PMA also. No?
Dr. Evangelista?
Yes, Your Honor. Sinusuportahan po namin yung suggestion na mag-usap-usap yung DOH at yung PMA tungkol dito sa mga problemang ito. Pero po pwede po sanang mahiling na isama naman po yung mga facilities doon sa usapan. Kasi po, kung hindi po kami isasama, tatlo po kasing component yan eh. Yung PhilHealth na siya nagpopondo at siya nagbibigay ng payment for the services that are rendered. Yung facilities na siya naman, ang tungkulin naman niya ay gawing maayos yung kanyang facility, yung staff niya, yung equipment niya, at yung pong doktor na nagdi-deliver nun. Yung nanggagamot mismo, yung nag-opera mismo. Tatlo pong components yon. Pero isa lang naman po ang layunin nun eh. Ang layunin nun ay magbigay ng serbisyo sa pasyente. Yun ang primary objective ng lahat. Tatlong components po yon. Sana naman po, kapag po nag-uusap, sinasama naman po yung mga facilities dito sa mga discussion na ganito para na ibibigay din po namin yung mga inputs namin.
Okay, thank you. Dr. Noche?
Yeah, kami naman sa PLC, we have to wait for a complaint before we act on particular violation. Kasi po, we are only maybe 25 legal officers, and there are about 46 regulatory boards. So hindi kaya ng aming legal officer to address the complaints. Pero ang hirap lang, wala pong dumarating na complaint sa amin. We have to wait for the complaint. So yun aming problem sa PLC. We are willing to address the complaints of patients because our focus is patient safety, and of course standards of doctors taking care of this patient. Regarding facilities, kasi you have to understand that there are three regulatory bodies in the government for health. One would be the facilities, which is under health facilities of DOH, which is Dr. Rosuman is here. Then if the facility has a product like stem cell, it is the FDA. Now, if it's about professional, then it is the PLC Board of Medicine. Ayan ang mahirap minsan sa existing program ng health agencies. Rarely we do the Board of Medicine being asked to accredit also. Ang request po namin is that in the accreditation of health facility, dapat we call it 3 Ps. Accreditation of the place, facility, accreditation of the substance, if there's a substance, and accreditation of the person running. So, yun lang po aming...
Okay, thank you. Dr. Padilla?
About accreditation, another reform that the Department of Health is instituting now, because we realize that there's a disconnect between the Department of Health and the PhilHealth sometimes in accrediting institutions. And so we are examining gaps such as
accreditation of the substance, if there's a substance.
an AO that said any healthcare institute that makes it difficult for PhilHealth then to discipline agencies, because the UH will just accredit them and we're supposed to accredit them. So even that now is being studied and it's going to be amended. Plus, makes it difficult for PhilHealth then licensing as well.
Uusap yung
PhilHealth, yung DOH
yung Department
licensing at yung PhilHealth
yung
accreditation. So
yung
now,
kasi yung PhilHealth yung yun PhilHealth yung
money.
May batuta.
Pera,
In other words, parang yun ang pulis eh. May police power. Malakas ang batuta na dala niya. Yung batuta, yung stop payment. So they really have the power to put the institutions in line. So it's but proper na dapat magkaugnayan and they talk to each other. Maybe that might be ripe for legislation. Yes. But yes, Doktora.
Pwede pong isang input pa. Kasi yung nangyayari, yung fees na binibigay po kasi sa institution, hindi na ngayon agad diretso yung kumbaga yung surveillance ng PhilHealth dun sa mga doktor. And aside from that, there are instances also where the institution may hold on to the money that was given to them, although sinasabi 30 days. Pero hindi naman po kasi laging napapatupad yung 30 days. So nasa institution yung pera, pero yung mga doktor, hindi nila agad nakukuha yung kanilang pera. So pwedeng sabihin natin na binigay naman sa doktor yan, pero hindi naman nangyari. So ang isa po sana naming request ay kung maaring i-disaggregate ulit yung PhilHealth claims ng doktor sa in terms of efficiency siguro medyo mahirap, pero ang tingin namin nawawalan kasi ng direct accountability yung doktor sa PhilHealth dahil kasi hindi naman niya actually nakukuha kaagad yung kanyang fees for services that they have rendered. So I think it's also one thing that we should consider.
Yung nga ang punto ni Dr. Evangelista kanina. But anyway, Dr. Padilla wants to... Attorney Padilla, nagugulo na. Okay.
Hindi, marami hong issues na pinag-uusapan at talaga naman nagdidiskusyon yung mga iba-ibang grupo tungkol ho rito. Pwede naman pag-usapan ho lahat yun. Pero ang isang dahilan ho kung bakit hindi na namin dinidiretso rin ho sa doktor ay dahil ho ang sinasabi rin ho namin dyan is that responsibility ng institution ang mga doktor. They have to credential and they have to privilege yung mga doktor. Pag hiniwalay ho namin ulit yan, ang mangyayari ho dyan, ang doktor ay pwedeng gumawa ng kung ano-ano sa isang institusyon and expect to be paid. Ayon ho sa alinsunod sa nilatag ng ating Korte Suprema, talagang visiting man, consultant man, salaried employee man, ang doktor sa isang institusyon, ang responsibility niyan ay ang hospital. Dahil ho, in the minds of our patients and members, pag ang isang pasyente o tao pumasok sa isang hospital, hindi ho niya iniisip na, baka si Dr. A ay walang kwenta. Yung ganun ho. Pagpasok ho niya sa hospital, alam niya ang hospital ang nagbibigay sa kanya ng care and sustenance na dapat sagutin lamang ng hospital. Kaya ganun naman ho. Pero sabi ko nga, wala naman hong pinal na dito, pwede ho natin pag-usapan pa yung mga iba pa hong arrangement.
Oh yes, I understand that. But sometimes it just occurred to me yung sinabi nga ni Dr. Evangelista, for example, yung kaso ni Dr. Fontanilla ba yun? Yung merong nga seeker siya, pero sa bahay niya dinadala, tapos we make the facility liable. He cannot, although the Supreme Court said jointly and severally, but the problem is the facility cannot reasonably, it seems the facility cannot reasonably police the actions of a doctor outside the facility for activities done within the reasonableness. Dr. Padilla.
Opo. Agreed ho na hindi niya baka nakikita ng facility yung ginawa sa bahay. Pero ginawa ho yung procedure sa facility. At dun ho nagkaroon ng problema kung may problema ho. Yung nabanggit ho namin mga ehemplo kanina were problems that actually dealt with the patients after the cataract was marami doon hindi pala kailangan. Meron doon mga nabulag. Ito ho should have been avoided, no? If they just done the proper procedure.
Okay, yes, that's well taken. Yes, the procedure was done undoubtedly in the facility. Dr. Evangelista, I see that
yes.
you really
yes,
want to react. Yes.
Your Honor, the facility was indeed done in our the operation was indeed done in our facility, but not the solicitation, Your Honor. And ang dahilan naman po sa hiwalay po yung aktibidades nung doktor at iba naman po yung accreditation, hindi po ba pwedeng i-stop payment nila yung doktor at wag po yung facility? Kaya naman po nilang gawin siguro po yon. Kasi magkaiba naman po yung sabihin. For example, Dr. A, ikaw nasususpetsahan namin may ginagawa kang mali. So kahit saan ka magpuntang facility sa buong Pilipinas, i-stop payment kita.
Okay, Doctor, that point has been made already and it's quite clear. Maybe you can...
Ko lang ho, Senator.
Oh, sige, Attorney Padilla.
Actually, dun ho sa inisyu namin na stop claims no, ng payment, ay kasama ho doon ang lahat ng doktor involved in those indicated. So talaga ho, pati yung mga doktor mismo, pinagbawal, regardless kung ano man home facility, pumasok sila.
Ah, I see. So I presume meron kayong procedure kung yung doktor na yon pumunta sa ibang eye center, eh, hindi rin nyo babayaran yun.
Bali, lalabas ho sa amin yan, may red flag na ho kagad si Dr. A na nanggaling sa particular facility, pero namin yan, may red flag na ho kagad si Dr. A, ho namin babayaran.
Yes. Okay. In the next hearing, the hour is late now. Let's just take up a few things. In the next hearing, Dr. Evangelista, can you bring Dr. Fontanilla? This is more of an invitation. Please relay to him, but we will formally send him an invitation.
Yes,
I'm just telling you that since you deal with him, just inform him that we are inviting him.
Your Honor, I have to say that our relationship
Yes.
to Dr. Fontanilla at the best possible effort. My best possible.
That will be appreciated if you want to use the word best possible efforts. Although, you know, when you pay him your checks, I'm sure you use also
Yes, Your Honor.
from PhilHealth, you do use your best possible efforts to locate him when you pay him the checks from PhilHealth. And at any point, use your best possible efforts. Okay. The other thing is, Dr. Audit. Sa claim, Dr. So, am I correct? Ang nakapirma sa claim, si Dr. Brian Ongkian Kok, pero ang talagang, am I correct?
His accreditation is suspended by PhilHealth. Yes, Your Honor.
And that was the case cited by Attorney Padilla kanina, yung nabulag po.
Yes, Your Honor.
Dr. Goseng Fiao, would you care to respond?
Yes, Your Honor. Hanapin ko lang po muna yung response ko para eksakto. Your Honor, meron po kasing circular ang PhilHealth mismo. Actually po, nung nangyari po na nasuspend si Dr. Barasi in 2013, tinanong po namin ang PhilHealth. Kasi meron pong circular ang PhilHealth that says na if there is a PhilHealth accredited doctor on board, meaning co-managed or co-surgeon in Dr. Barasi's case, then he can operate and the case will be paid. So yun po, lininaw po namin sa PhilHealth. Does that apply to Dr. Barasi? And they said yes. So I think that's circular number 31 of 2013, no, that says that. And when they said yes, then ang sabi po namin kay Dr. Barasi, well, you have reduced privileges. You cannot operate on PhilHealth patients by yourself. Kailangan meron kang on-board, meron kang co-surgeon. So that's exactly what happened. No? Meron siyang co-surgeon and they manage all cases together.
Dr. Padilla. Attorney Padilla.
Ang sabi ho ng pasyente ay ang nag-opera lamang ay si Dr. Barasi.
Kailangan meron kang on-board, meron kang co-surgeon.
Lamang ho sa amin ay si Dr. Brian, no? Kung di ako nagkakamali. Dahil nga siya nga accredited. No? So, ewan ko kung sino ho ang natanong sa PhilHealth about yun aming circular, pero pag sinuspindi ho namin ang accreditation ng isang doktor, ang ibig sabihin nun, hindi ho siya pwedeng mag-opera at mag-file ng claim. But in this instance, siya ho ang nag-opera ayon sa pasyente, pero iba ho ang nag-file ng claim. To us, fraud ho yun.
Your Honor, may I?
Yes, Dr. Gosepio.
Your Honor, number one po, we have not had a chance to answer that allegation. No, bago linabas yan. No. I think that's very important because
this is your chance.
Yes, Your Honor. No, Dr. Ong was there at that time. In fact, the OR technique has Dr. Ong and Dr. Barasi's name. Kaya lang, syempre, ang pipirma sa claim, hindi kasama si Dr. Barasi, si Dr. Ong lang po. And then, the consent form includes the name of Dr. Ong, no, because he was there. And then, you know, syempre, we have the affidavits of our nurses that will say that nandun siya. But I think the best proof for that will be the time in of his car, no, into the building, and it will show that he really was there at that time. No, so perhaps we have the affidavit, the time in of his car, building, show that he really was there at that time. Pasyente or hilo yung pasyente because it's a very, very, you know, to undergo an operation there, and the co-manage the
personnel was around in the operating room during my entire operation. So kami ho, binabase lang namin. Kung nagkamali ang pasyente, baka nga. Pero ito ho ang sinabi niya, sworn affidavit, at mas paniniwalaan ho namin ito kaysa sa nurse ng facility, no? Na alam namin na kumukuha ng bayad naman sa facility. So yun lang po. Yun lang po.
Okay. The hour is late. I would just like to, before we suspend the hearings, Dr. Evangelista and Dr. Goseng Fiao, you have expressed willingness to cooperate.
Of course, Your Honor.
Of course. So, the Blue Ribbon Committee will be contacting you to get from you the contact numbers, the addresses of certain doctors involved. We would appreciate if you give us the numbers, the address, the contact numbers of the doctors involved.
Yes, Your Honor.
If Your Honor, may I ask what of the status of the suspension of our facilities?
That's not for me to answer. I think PhilHealth has to answer that. But to my query, is that a yes?
Yes,
okay,
of course,
okay.
yes.
Dr. Padilla.
Well, right now ho, suspended pa ho ang payments. We will be coming out with our judgment or decision on this in due time ho. Hindi naman ho. It is still less than 60 days from the time that it happened na meron naman kami by law ho authorized to do so, and we can, you know, but hindi ho yan tatagal.
Dr. Goseng Fiao.
Your Honor, we still don't have our bill of particulars. No, we have it's very vague. The audit findings is very, very vague. No, it just says na you have 12 patients said this. We can't even confirm who the patients are, if they really are patients. No, so we would like to be able to answer intelligently.
Attorney Padilla.
I've just been informed that we just received their motion for a bill of particulars sa kanilang abogado ho ay Accra Law Office only recently. I think less than 10 days. So hindi pa rin, ngayon lang ho namin natanggap, and we will respond to it accordingly.
Thank you, Your Honor.
Okay, the hour is late. We still have a lot to take up, but a lot of interesting points, lalong-lalo na sa policy, yung issues na ano bang diferensya ng solicitation at advertisement, but dapat ba natin luwagan? As pointed out in the States, so why did they ease up there and here we're very strict? Or should we just continue being strict? And should there be accreditation by the medical associations, including the specialty associations, for accreditation to PhilHealth, and many, many more? Should the payments of the doctors be disaggregated again? So there are a lot of questions, policy questions that have come up and are very helpful. Dr. Padilla?
Before we forget, there are also the suggestions for new amendment perhaps to the legislation to really have laws against insurance fraud, health insurance fraud, because we have laws which are very weak and not specific for the problems we are facing.
Yes,
So-
Yes.
Yeah,
Yes,
that's
Your
one of the
Honor.
ideas
Yeah.
that's percolating in the committee is a bill having a new specific offense called the PhilHealth fraud.
Yes, that would be great. Thank you, Your Honor.
Thank you. I'd like to thank everyone for coming. Your presence is highly appreciated. Thank you for your time. We know you're very busy. And in the next hearing, we will not issue an invitation to those already invited, to those already present. The next hearing will be next Wednesday, 9 in the morning. So, again, until further notice, until Wednesday next week, this hearing is hereby suspended.